morning, everybody. I want to welcome you to this year's conference. This is our 50th conference. This year's the theme for this year's conference is social justice, where to now? Social justice is an extremely important part of social work, and it's really apt that at our 50th year that we look at where are we taking that piece of our profession and of our work. In terms of just a little bit of housekeeping, we will be some built-in breaks today. There'll be a break at 11. There'll be a break for 15 minutes at 11:15. And then we'll take a lunch break at 12 for an hour. So we do hope that you are able to come back and join us through the whole day for what is a very exciting conference lineup. In terms of just a little more housekeeping, as people who know me know, I'm not very in terms of Twitter and tweeting and all of that. I don't do it, but I will let you know. I'm telling you today that if you're tweeting, which many of you do, use the hashtag social work responds or social work or social justice and tag at IASW _IRL. The questions will be taken at the end of the session. So at the end of this morning and at the end of this afternoon, we will take questions, and you can put the questions up on the Q&A section. Okay, so not into chat, into Q&A, because that's where we'll pick them up. All of the presentations will be available next week on the event page of the IASW website, which, as you know, is full of loads and loads of really, really useful information for social workers. I'm going to start my own presentation now. So if you can share my screen there, thank you. So I got the lovely task of thinking about the IASW and in its 50 years. And it was at first a little bit daunting, but then I thought, what an interesting thing to do, because I've been around, not quite for the 50 years in social work, but for lots of it, 40 odd years at this stage. So what's happened over the 50 years of IASW? To remind you, why do the IASW exist? We exist as a representative body to advance the interests of our members, right? And we represent social work. We work to advance the interests of our members, the profession, and service users, working together for improved lives, social justice, and equality for all. That's why we exist, and how we do it and what we do are other matters. But if you're not a member today, we would be delighted to join you up as a member as soon as you're ready. 50 years ago, what was happening? IASW started in 1971, okay, and to put that in some kind of context, it was the year of the very first email, just to put it in a context. But it was also the year when women's rights and the liberation of women were really beginning to march, right, in Dublin. Certainly in Dublin. There are differences between Dublin and rural Ireland in the terms of how fast those things moved. I would always say, being a teenager of the 70s, I would always say that the 1960s sang about free love and the 70s was a lot less about singing. Liberation in terms of contraceptives. There was the famous traveling to Belfast to buy the contraceptives, which is that slide, which everybody's quite familiar with now. Women expected to be served pints. Those of you out there will probably not realise that up to that, women in even Dublin pubs were only being served half pints. And that was one of my, really in my college days, you know, I was determined to get a pint in every pub I could. We were the first generation of women that really expected to have a career and a family. Before that, it only really happened by accident for women where they were widowed young or with young families. So up to that, women, you know, up to I can't remember what year in the 70s it was, but women couldn't continue to work after, but we could. When I started working in 1978, we could continue to work, have a family. We were going to be super women. We were going to do it all. And that was the kind of vibe of the 70s. Coupled with that, you got things like the unmarried mother's allowance commenced in 1973. Not the way we speak about it now, because there are lots of other kinds of lone parents besides women. But certainly that was a really, really important time for services. Added to that, there were cars driving up Grafton Street in the 70s. These are all things that are really hard to imagine now. What was the ISW doing? They're reported in the paper as being angry and deeply worried. And I liked both of those phrases about the issues of the day. Maureen Murphy was the chair from 1971 to 1973. And they looked at things like the Children's Act. The 1908 Children's Act was what was people, we were asking for that to be reformed. Care of the elderly, widows and deserted wives, juvenile justice, housing, relationship-based social work, communication, care in the community, agency cooperation, preventative work was needed. But we were also worried about salaries, working in isolation, career structure, training. Now you'll see there's a slide there of people pushing a car, and those of you who are old enough will remember having to do that as we queued for petrol because of the oil strike in the 70s. And you know, the country, you had to queue to pick up your petrol, no matter what your job was. And you were lucky to get it. And that was what would happen. People would run out of petrol sitting in the queue, and everybody'd have to get out and help them push. In the papers, while also being described as angry and deeply worried, sometimes in one article I read, it said that sometimes social workers are thought to be like nuns in plain clothes. Now, this slide is a photograph of the inaugural dinner of the ISW in a hotel in Dunleary. And they don't, while I've worked with some amazing nuns in those days, these ladies do not look like nuns to me. So as we went through the 70s, right, this is a real whistle-stop tour of the ISW. As we went through the 70s, we had various other people took the helm. And in 1973, and their names are up there on the slides, Frank Goodwin, Marilyn Rowntree, unfortunately, Noreen Carney, and Augusta McCabe. And in 1973, the church and state control was really, really, evident in Ireland. And at our conference, while we had the attention of the Minister for Health, who attended our 1973 conference, we also had the famous Bishop Eamon Casey spoke at that conference. But at the time, it was the church that ran, aside from some of the community stuff in the health boards, it ran a lot of the services, the other services, hospitals, all the social services were run by religious people at the time. Now, what was happening in social work? There were only 43 social workers employed in our, what were called our health boards, which it's the service that's now TUSLA. We were very concerned about, casework was a big how we were managing that, and community development was a really strong part of social work. However, there was a problem because most of our social science graduates were heading for England to work in England, and therefore we had insufficient staff in social work in the 70s. There was no postgrad education in Ireland. To get postgraduate education, people had to go to England. And in fact, the salaries were pretty pathetic. The car you see there, Renault 4L, which was a kind of a real 70s car, and it had its gear stick up in the middle of the dashboard rather than way you would be down where you would be familiar with it now. And lots of social workers drove that kind of car. We were always very jealous of the English social workers, because in fact they got kind of company cars, and they weren't meant to use them at weekends, and they became very adept at disconnecting the clock at the weekends, so they could drive all over England during the weekends, and back in and connect it for work on Monday. By 1986, the IASW had 400 members out of 1,000 social workers nationally. So that was pretty good. And by that stage, we were already 10 years advocating for professional registration for social work. Of note, there were no social worker representatives on health boards. Other professions, yes, were represented there, but not social workers. And more social workers were needed in all services. Now, during that time, Augusta McCabe was elected president of the International Federation, and IASW are still very involved with the International Federation, to the credit of quite a number of our members who promote that. And we will have somebody from the International Federation joining us. More social workers were needed in all services, but the 80s was a time when there was actually an embargo. I started in what were called the health boards in 1982, I felt like one of the youngest social workers for years, because there was an embargo on employing any public service staff across, and because of that, teams stayed very small, what were the issues the IASW were looking at? Justice, poverty, social policy. What was our government doing? What was happening in training for social workers? Child sexual abuse was barely beginning to be talked about, and childcare reform. And this was the time when Dublin. Now, again, I'm with due respect to those of you who didn't live in Dublin or work in Dublin, Dublin was awash with heroin. I had grown up in a very easy suburban Dublin. I didn't know what a drug was, and in 1982 I had to start to learn very, very fast, because all of the young parents in Dublin South inner city where I worked were getting involved. Certainly the ones that needed our help were getting involved with straight onto heroin, and their children were consequently coming together. The picture there is of the Pushers Out marches, which were, that's Ballymun, and I worked in Ballymun from 1986 to 1989, and I remember those marches, and they were frightening, and they were serious, and they were, they were kind of, orchestrated by the local communities who cared deeply about what was happening to their children and families, but also, of course, there were political interests in all of this as well. In 1989, this is a picture of Liberty Hall. So in 1989, the IASW had an office in Liberty Hall, which is, the seat of our trade unions, James Connolly, all of those things, very historical setting to be in. I gather from reading some of the stuff I've read in preparation for this, that the room was a little small, but I would have liked to have been there that day. It's a very historic and iconic building in Dublin. We had the people who looked after IASW during those years, during the 80s, were Mary Kennedy, Margaret Horn, Owen Keenan, Jill Stevens, a former tutor of my own in UCD, Vicky Summers, and Eilish Walsh. Eilish, who also served in IFSW. And what were the kind of things that we were struggling with? There was a massive AIDS crisis, and unlike the States, where the AIDS crisis kind of became to be known about first, where it started as a disease for our gay population. In Ireland, it was very much a disease of our drug addicted population. And I, in the work I was doing, where I was beginning to see young people dying. And I know people who stayed in our drug services began to attend a funeral a week of people who were dying from AIDS in the 80s and early 90s. There were lots of silent minorities. Even today, the difference in the voices that people have in relation to, for example, gender issues, those voices were just silent minorities. They were there, they were hidden. Nobody, there was no recognition for any of the issues of today. There was a call for for an Irish qualifications board, because at that time our qualifications were being awarded by what was called SETSWA, which was the English qualifications board. We were concerned still about the Child Care Act. We were still operating from the 1908 Act, waiting on the new Child Care Act to come in, and the financial viability of the IASW was in question. And there was a pub quiz held to try and raise money by Pat Waldron, who I'm heard was an absolute stalwart of what used to be called the Eastern Region, part of the ISW, and they raised £80 for the ISW, which was a significant amount of money in those days. In 1989, ISW moved to St. Andrews, where we are today. And again, another quite historic building. And to put that in a kind of a world context, that was the time when the Berlin Wall came down, when Europe began to open up. It was a time when recession was just beginning to recede. The 80s recession was just beginning to recede. And there were the massive changes across Europe. However, there were still massive issues regarding poverty, our minorities, all the minorities, the new childcare law, drug addiction, and AIDS deaths. As we moved into the 90s, I put up the slide of the Friends, the picture of Friends, the TV show, okay? Because I certainly, in work that I did, that was often young people, young teenagers of the 80s and 90s kind of thought, oh, if I'm out, grown up sharing a flat, that's what it's going to be like. That was what lots of people aspired to, was that kind of, this is what growing up meant. And it was very much a time of, we all started, you'll actually see up at the top of this slide here with the Liberty Hall, you've got a little plane flying across the sky, which I put in. That's Ryanair. Ryanair started in the 80s. By the time we got to the 90s, we all knew what Ryanair was. We all began to have money and everything else, the means, and as the Celtic tiger began to roar. What were the issues at the time? Disabilities. We were really beginning to think about our people with disabilities and what was happening for them. Children's services. We had the new act. The age of the child had been changed from 16 to 18 when the 1991 Act came. You can imagine what that did to services, what it did to caseloads more especially. Mental health issues were really, really still really important. And the mental health issues that begin to emerge from all of the trauma of drug addiction, alcohol addiction, as well as, all of the other mental health issues that have been there. In 1996, we had a Refugee Act passed, and that all has become quite significant for Ireland. The people at the helm in those days were Anne O'Loughlin, Imelda Keogh, Frank Moran, and Anne Meehan were the people who over those years shared the chairmanship and presidency of the ISW. And in our office, we had Margaret Fitzgerald initially, and then Mary McDevitt. And I read a lovely piece that Mary had written for our 40th anniversary 10 years ago. What was happening as the Celtic tiger, this is Johnny Ronan riding the green Celtic tiger in that picture. And you can see he's gone the wrong way up a bus lane. And that was typical of the attitude of big business. They were going to do what they were going to do. And what we know happens is that, that doesn't improve things for the poor, for people where there's massive inequalities. It doesn't bring services on. And it doesn't help issues like addiction and housing, because people are there the big business is there to make money. What services try to do at that time, particularly disabilities will be very familiar with this, is they try to bring in quality measures. And that became, prior to HIC or anything coming along, they tried to bring in, so the Council on Quality and Leadership was one that I became quite familiar with, and personal outcomes and all of this. And that was an attempt to actually apply business methods to social services. And I'm still not sure that works. So we move on into the 2000s. And Monica Egan did a long stint as president of the IASW from 2000 to 2006. Most of the presidents served for 2 years. Monica served at that stage for 6 years. And what were the other? Mental health was still big on the agenda. Children first, how the children's services were being rolled out. Addiction, still always in Ireland, the addiction problem is a big one. Childhood poverty began to be spoken about. There were issues around kind of new disabilities. The keeping of electronic records, issues around residential care and whether it was an appropriate way to look after anybody, and the Commission on Child Abuse happened during the 2000s. That was the time. It's only since then that we have a grade called social work senior practitioner grade came in, fought for by the unions and advocated by IASW too. Human rights. We spoke about human rights. We spoke about the new Health Act in 2007. Quality issues, globalization, the expansion of the EU in the 2004, which was really significant because what that did was it brought amazing new communities to Ireland. And also because of with the bringing in of refugees, we began to see the emerging issue of direct provision and all that brings. During the 2000s, HICWA started up. We got our own quality people to come and look after us. And to just put in context, it was the decade when I remember sitting in my office when the plane, I happened to have a TV in my office, when the plane flew into the Twin Towers, and another social worker came up and said, quick, on your television, something terrible has happened. You can see this cartoon is the Celtic tiger was heading in 2007, it was heading over a precipice, and our unfortunate then Minister for Finance is depicted here, and the EU have a helping hand out to us, and the rest you probably know. So what happened in the 10s, we had the 90s, the noughties were the 2000s, and then I think they call it the 10s. So Carew became a big part of our concern, as in we got our own. We were the first profession of now, I think 13 to be registered by Carew. So in that way, social work has really, we've tried it out for everyone, and the rest have all come in behind us. And I think we've learned an awful lot about registration, the positives, which we've always looked for the positive sides of registration, and of course, some of the difficulties. And the other health and social care professions at this stage are very grateful for, sometimes the advice that the IASW has to give them around Carew. It was the time of bringing in what the English social services would call austerity measures, and we've had quite a few austerity measures. Social workers took in public service, where we're largely public servants, almost exclusively in this country, public servants, and we took wage cuts like everybody else. You know, we and it became a difficult time as recession bit uh, for people, and again, you're much more familiar with those problems now. Um, so the kind of things, mental health never goes off our agenda. Children never goes off our agenda. Inspection of social work services came onto the IASW agenda. CPD big time with Carew, and CPD will remain, has always been a very strong part of the IASW. Disability services, what was happening with them, things like assisted decision making, direct provision, aftercare, guardian ad litem services, adult safeguarding, loneliness for our elderly people, advanced healthcare directive. These are the kind of things that you'll find on our website that during the 10s IASW were writing about, were advocating about. Assessment of need, delayed discharges, Carew Code of Ethics, Brexit, human rights, migration, the Home Coalition for our aged population, bereavement. There's significant documents documents were written in relation to all of those issues during the 10s. One of the significant pieces about that decade was that IASW became a registered company. Now, I wasn't on the executive then, but through my personal life, I happen to have been on the sidelines of hearing somebody advise about the registration of another company. I know the amount of work it is, and that's why I know how much work it is. And pictured here is Inica Derville, a former boss of mine, and Inica steered the helm of the IASW through that process to become a registered company, as well as all of the other things that get required to do. And she did that for 6 years, from 2008 to 2014, and saw us through that period. And that was the real period of growth in developing our whole CPD piece. And two other people who would have been on the executive during that time, Donald O'Malley and Frank Brown, they would have been on the board, went on then to share as chairs. And when we went from being presidents to chairs when we became a limited company, and Donald and Frank went on to serve in that capacity after Inica. It was a massive piece, and this photograph, which I think is a really nice picture of Inica, is from a newspaper article that I found, and I thought it was just a particularly nice picture of Inica, somewhere in the environs, I would think, of St. Andrews. I think by the look of it, a red brick building anyway. 2018, big year for IASW, because the IASW, on behalf of the International Federation of Social Work, hosted the Social Work Global Conference. You cannot underestimate, a bit like the formation of the company, you cannot underestimate how much work that would have taken. I think it took years of John Brennan's time. I won't say life, but I think it certainly took years of his time. You can see, those of you who weren't there, there's the massive hall in use in the RDS where it was held, and these would have been the big plenary sessions, would have had that many people there. People came from all over the world to it. It was amazing. It was an amazing time. John was assisted by various people, the International Committee, and of course Cleana, who's there in the picture with John. and it was a very significant event for IASW. As we go forward in the 20s, our office today is headed up by Danielle McGoldrick, who's our office manager, who you all know very well, Keena Murphy, our CPD officer, and Sarah McDonnell, who I put a picture up so that you'd get to see her face, because you've probably only spoken to her on the phone. You can see our current board and our interest groups are there in that slide, and I hope I haven't left anybody out. What are we concerned about at the moment? Lots of things. Of course, in the 20s, COVID-19 came in and kind of knocked things on the head in terms of how we had been doing things. It came in like a wrecking ball, and but it has brought us into a whole new way of working, and that's been good for IASW. So IASW had to go virtual really quickly, and it's a great tribute to the staff that they just moved home and they got their gear out there. You know, they did it painlessly for us on the board, and it was fantastic. But issues became all of those issues that are there. Social work during COVID survey, that's been significant, and we're still working with that. Our residents' rights in nursing homes during COVID, we're still working with that. Working from home, of course, still has its challenges. We've got much more used to it. Safeguarding in lockdown became an issue. Social work recognised as an essential service. That was a big thing for me the day Leo called social work out or in the list of professions. I was really proud. Virtual IASW, we're getting better, I hope. CPD went online. Thank you, Kleena, and everybody else who's contributed to CPD over this time, and our crowd cons, our partners today. We had our first AGM online, etc., etc. We've had a great membership campaign. Membership is healthier than ever. We have hit the 1,500 membership this year, and that's fantastic, and we hope to continue growing. We'll talk more later about anti-racism, and we are very proud of our moving forward into the next 50 years with this, with the profession as it is today. It's a varied, multicultural, multiracial profession that I really enjoy working in, and I hope that we can do great things as we go forward. Okay, that's me done in terms of 50 years. And yeah, okay, sorry, I need to introduce our first speaker to you. And okay, Caroline McGregor. Caroline, and this always gets me because I wonder, is she Caroline Skehill or Caroline McGregor? And she's professor of social work in the School of Political Science and Sociology and senior researcher at the UNESCO Child and Family Research Centre in Galway, in UI Galway. She has massive interest in child protection, welfare history, child protection and family support practice and policy, citizen-based social work and social work perspectives. And she has published on support and protection across the life course. So I'm going to hand you over to Caroline, who's going to talk to you about reflections on the past to inform present and future in relation to social justice and social work. Thank you, Caroline.
Thank you very much, Anya, for the welcome and for the really interesting reminder about the fantastic work of the IASW. It was lovely to hear all of the names of colleagues and former colleagues mentioned. Thank you very much, IASW, for the invite to speak today. I'm delighted to be here to speak to you, reflecting on our past to inform our present and future discussions in relation to social justice and social work. I suppose to set my talk in context, I'm coming from the view that I see social work is complex and sometimes contradictory. I don't think there is one unified history of the present. I think we have multiple histories and presents and indeed futures. And I come to you today as a colleague to work this out together rather than a claimed expert on history of our present, even though I will draw from my own experience over different moments in time looking at the history. And I do acknowledge, colleagues, I've applied a lens in history, specifically looking to history to understand the present at different moments in time. And that has influenced what I've seen, but also what I may not have seen or missed. So I acknowledge your memories and your experiences and your involvement, like I want you just to discuss there in terms of actual events over periods in time in history, and that our thoughts and understandings may differ. And I look forward to conversations about our histories. I think we need to think about the past just as we do the present, where we see it as complex and don't try to distill it too much or overgeneralize. The approach I take, as I've mentioned, is history of the present. That involves seeking continuities, looking at what seems to be constant across time, and discontinuities, changes over time, looking at specific points in time and looking at history to critically inform. So happy birthday, IASW, a fantastic achievement, 50 years. So I'd just like to kind of remember some of your forerunners in terms of the history. There was another Irish Association of Social Workers in the 1950s, which was a mix of qualified, trained social workers, social welfare workers, and others working within social services. You also had the Irish Association of Medical and Psychiatric Social Workers, which was established in 1964. And it was actually those two bodies who came together in the formation of what we now know to be the Irish Association of Social Work, that was set up in 1971. And those organisations, especially the Irish Association of Medical Psychiatric Social Work, were preceded by two individual organisations for hospital social workers, the Institute of Hospital Almoners, where there was an Irish branch from 1937, and the British Association of Psychiatric Social Workers, who also had a branch. So just to give an acknowledgement for our former associations as well. When I think about social justice in social work and looking at the different moments in time, one discontinuity that strikes me within the dominant discourse of the time, thinking about the mid-20th century, is the work of the Joint Committee of Women's Societies and Women Social Workers. They're referred to in the final report of the Mother and Baby Home Commission that I'll mention again later in my talk. And I first discovered them in my own historical research. And I was fascinated and delighted to find, amongst a dominant discourse of patriarchy and dominance of church moralism, that you had this dynamic group of women organisations. Some of the organisations are listed here in the slides, and social workers, including membership from the Hospital Almoners Association, which was the medical social workers group. And the kind of issues the Joint Committee were concerned about was broadly around advocacy for reform for women and children, reform of childcare services. The committee were one of the first to call for the legalisation of adoption in Ireland from the 1930s, when they were established in 1935, even though if you look at some of the general histories of legal adoption, they don't always get the credit that they deserve for influencing those developments. The committee came up with a very strong argument to support unmarried mothers, as they were called at the time, to keep their children in terms of supporting their economic capacity to do that. And they put in a proposal, which was of course rejected, to transfer the money that was being paid from the government to institutions for capitation for keeping women and children in homes directly to mothers. They campaigned for women to be in the jury service, to join the guards, for constitutional reform, for reform of boarding out. And in 1945 had a very strong paper challenging the overemphasis in relation to unmarried mothers and their children on the wrongdoing of the women when there were two guilty parties, and they say that the man gets off scot-free. So even though it was a minority discourse, it's important for us to remember that at different moments in time, we need to listen to both the majority, but also the minority discourses. And I'm very proud to know that this society existed and had social workers in it at a time where it must have been very difficult to do this type of advocacy work. They also called, when the adoption board was set up, for equal representation of men and women. Again, it didn't achieve that, but nonetheless, we're calling for it. Anya has already mentioned Irish social work in the international context, but just to kind of acknowledge it again in the context of Irish social workers developing their social justice practice, a real opportunity to do that was through membership of the International Federation of Social Work, and the first IASW gained membership of the IFSW in 1966 and would have been involved in consultations with the United Nations and UNESCO. And I was reading from an article by Eilish Walsh about this, about Irish social workers presenting in Helsinki in 1968 on the theme of social welfare and human rights. And this membership was alongside membership of another Catholic international organisation that social workers would have been members of. And Eilish, I suppose, sort of talks very strongly just about the remarkable international activity that the association has been involved in over the years in terms of an international context. And I just came across reference to this press release that the association made in 1975, calling for development of practices in relation to migrant workers, social fund, economic issues around equality of treatment for men and women, as well as addressing our training and mutual recognition of diplomas. But when I think about the challenges of social justice and individual practice, I think sometimes we can tend to see social justice as being a little bit far away from our individual practice, or that we're always trying and somehow to reach for this goal, this ideal of achieving social justice in our practice. I think in the past as well, sometimes we've been what Chris Rojek calls gladiatorial in terms of setting up the ideas that inform our social justice practice. And I think in the past, we needed to have, I suppose, a very strong development of what might be called individual social work and radical, but it often presented opposition of reform social work versus revolutionary social work, or social work as a reinforcer of injustice, or a fighter for justice. Is social work maintenance of social control or transformation? So these debates were very, very strong in social work, particularly 70s, 80s, 90s. And as I say, I would kind of concur with Rojek, sometimes maybe it's gladiatorial, that we need to sometimes have an oppositional stance, a non-violent oppositional stance on issues. But in other times, which I'll talk a little bit more, there's maybe different ways to think about how we do that. I, with some regret, would have to say I was a bit over gladiatorial myself in my past writing. I remember a really excellent paper by Fred Powell speaking about the potential for social work, for social justice, especially cultural justice, in 1998. And at that time, I responded with, I very much back up the points I made, but the manner in which they were made were, in my view now, too oppositional. Of sort of critiquing that this, while in principle, social work is very much committed to justice and empowerment, that wasn't always reflected in the individual practice of the day. Shane Butler talks about this, where he's written about mental health social work and the history of mental health social work in Ireland. And he reflects on the kind of critical, radical time around anti-psychiatry and influenced by SAS in 1972. And he reflects on how mental health for a period of time almost became an area where social work students didn't want to go into because it was being associated with, I suppose, the critiques around psychiatry. And there's a quote here from him saying that some students and social workers at that time became, I suppose, so inspired by anti-psychiatry that they felt that maybe they shouldn't be contemplating mental health social work. So that's sort of in that moment in time. More recently, don't worry about the detail on this slide. It's mostly the box in the middle I want to speak about today. More recently, I've reflected a little bit about, 20, 30, 40 years on, what do these gladiatorial paradigms mean for us today? How do we develop our social justice practice? And I suppose I would argue that we still need different methodologies like community work, community education, structural work, and so on. But we also need to look at maybe the overall purpose in terms of to transform or reform practice, to look at the potential of individual and collective, and to be a little bit more nuanced, I would say, in terms of how we think about that. But the particular piece I want to emphasize is that no matter what area of practice that or what approach or method we're using, I would argue that we have these constants, like balancing care and control, like the ethic of following our ethical code, and also promoting social justice. And I guess that's a perspective I'm coming from today of rather than seeing social justice as something that's just one single item that we're reaching out for, that in fact social work and social justice is of concern across all aspects of our practice. I don't think I need to introduce Bronfenbrenner's ecological model to anybody here in the audience. I have been kind of adapting and looking at the critiques of the model and thinking how best you can use it in the present day. And I think it's really helpful thinking about social justice, both micro, meso, exo level, to recognize that some people have overlapping micro levels, like perhaps young people in care, they have two systems or more that they're negotiating. And social justice refers to social injustice, economic injustice, cultural injustice, and legal injustice. I know there are very particular definitions and meanings around social justice, and I'm really looking forward to learning today from the ongoing conversations that are going to happen at the conference. But for me, there's a huge overlap between rights, citizenship, anti-oppressive practice, and promoting equality. So in terms of thinking about, just to follow on from Anya, reflecting on some of the history of social work, to think about some key moments in relation to social work and social justice. And I have a picture book here, which I think is a very good reference point to start to think a little bit about examples of different histories of social work at moments in time, edited by my esteemed colleague and the late Noreen Carney, I would very much like to remember today. We edited this book and had a number of colleagues wrote chapters on the different histories. And I have to thank Leona, when we talked about having this, when doing this talk, she actually referred to this book and reminded me of the many kind of interesting chapters that would be very relevant for this talk. Gloria Kerwin in this book talks about one of the very early social workers in 1906, employed in Jacob's factory as a welfare worker, a bit like personnel in the present day. They would have provided social work placements. And one of the really interesting things I learned from rereading Gloria's chapter was that women who had to leave work when they got married were given a wedding cake, but much more importantly, in terms of their economic rights, were given a lump sum of money that reflected the number of years that they worked in an organization. And that's sort of an example of sort of protecting economic rights at a time where women had much less rights. Charlie Delap and Terry Kelleher provide really kind of challenging and interesting overview of local authority practice, particularly working with travellers and issues around accommodation. And they show very much how social work has been a contested practice, sort of sometimes caught up with having to implement the policies around assimilation in the 1960s, and then leading in terms of developing rights-based and anti-discriminatory practice. In the 1970s, local authority activists and practitioners, social workers, had to specifically ask for advocacy to be written into their job in order to allow them to be recognised for that important social justice action. Barbara Redmond and Anna Jennings talk about social work and intellectual disability, and they argue, and I very strikingly, just the level of discrimination and stigma in society in relation to disability, but that, they argue, spilled over into social work, and they refer to social work in the 1970s as a poor relation, to the extent that they felt it important to establish their own organisation as well as the IASW, which was called the Social Workers in Mental Handicap, which is the word that was used at the time, obviously not used for long after that, and that became a group within the IASW. It's really important as well to think about social workers, and many of you, I'm sure, listening will have lots of experiences to share of the amount of campaigns that social workers have been involved in, like the Turum campaign around the changes to child welfare that followed. A very powerful campaign group for the development of personal social services had very much leadership from social work, and a report that many people referred to in this book about an interdepartmental committee on social work. I believe one of the very few special committees on social work as a profession that has happened. It never got formally published, but it was influential in terms of positioning where social work was at the time. But as we look at those sort of, so we can start to see that there's some examples of really good practice of social justice, and we also see the practice has been contested. With Susan Quinn, I argued as we reflected on social work post-Celtic Tiger, that we sort of have a juxtaposition in social work that I don't think there's any doubt that we as a profession and as individuals have an aspiration and an absolute commitment to the wider justice role, reinforced by our connection with the international definition of social work. And there is evidence of some excellent pockets of human rights and justice practice, but that hasn't been the dominant form of our training. And I think we need to look at, we need to find a way to look at both the strengths and the challenges in relation to social work and our history, so that moving forward, we can be informed by that learning. So I have 6 themes that I'm going to briefly discuss for the remainder of this presentation that I think help us to, I suppose, just sort of think critically and identify important themes relating to social justice and social work. About the nature of social work, a little bit more on the ideas. I want to talk a little bit more about the care control function, highlighting just that the point I made earlier, that so we need to look at and see social work as necessarily contradictory and complex. Issues around gaining power as a profession and time to be able to do the kind of practice that's involved. So I'm sure all of you here listening know the general history of social work, whether it's in Ireland or in the UK. There's always been a dual pathway in social work between individual casework and between collective practice, like the charitable organisation, society, and the settlement movement. In Ireland, community development and community work and community organisation, I suppose, have really led in terms of giving us key principles and practices of social justice. And my colleagues, Maria Carroll and Anna Lee, talk about that when they reflect on community development in Ireland and the historical developments. But they would also say then, we're talking about the 70s and 80s at the time, and now remains still at the margins of social work. When we look at social work, Irish social work also has its own history that it needs to be understood because of the dominant context of the Catholic Church, particularly all church services, but especially Catholic Church over the mid-20th and into the 1970s, as Anya mentioned. So I suppose these 4 boxes that I've drawn from my own writing about the history of social work in Ireland, they overlap. We need to think about it in terms of its history with philanthropy, very much operating within what I call a socio-spiritual discourse of the 20th century, really up against it in relation to trying to, on the one hand, bring in secular professional social work ideas, mostly from training within UK, Northern Ireland contexts, socio-medical welfare, alongside very dominant church-based services and church-based ideologies. And then from the 70s moving forward. So I have a quote. I spent part of my PhD study when I did it it's probably 25, 30 years ago. I spent some time in the diocesan office of the Archbishop McQuaid and looking at the records of the Catholic Social Welfare Bureau, which was a very, very significant social service organisation in Dublin in the 40s, 50s, 60s. They developed the family welfare section in order for medical social workers, almoners, to be able to do their family placement in Ireland. There was nowhere else in Ireland that medical social workers at that time could get the family training piece for their course that they were doing. So it was very significant, but obviously there was what you might call tension between the religious-led ideas and the almoners. And this quote just jumped out at me, and I have used it before, the Archbishop McQuaid worrying about social workers, and these lady analysts our people do not want lady analysts in their lives, and motives. Trouble is certain to develop if almoners undertake psychological investigations in our homes and hospitals. So just to kind of give a sense of the kind of challenges workers at the time would have been up against. I think it's also really important, I'm talking about social work, but we need to recognise that social work isn't just one single unified strategy. Looking, for example, at the final report of the Mother and Baby Home Commission, I was able to see references to social work in relation to adoption, community care, social work in institutions like in Pelletstown, social workers in hospitals in relation to maternity and antenatal and care, specific services for unmarried mothers, residential care and probation. So again, encouraging us that we need to think about some unified issues, but also diversity within our social work histories. I've said a little bit already about the theme of ideas of social work, but I think when we're trying to learn from the past, what's really, really important is that we don't sit and use our knowledge from the present only, because that's presentist and that's revisionist. So, you know, we shouldn't ask, well, why weren't the social workers referred, you know, who were working with unmarried mothers and maybe reinforcing dominant norms and dominant morals? Why weren't they doing anti-oppressive practice? Well, nobody had written about anti-oppressive practice in the 1960s. You know, that hadn't developed as an idea. We didn't have as strong an emphasis on kind of what were originally radical social work ideas in the 70s, which I think many have become mainstreamed now in terms of human rights, social justice, service user engagement, individual collective responsibility. So when we're thinking about our practitioner colleagues in the past, that's what I mean when I say situate the moment. You need to ask, was it 1930? And if that's the case, well, what type of ideas? They were mostly probably moralistic, single values, some focus on individual, and strong, maybe community-focused practice in relation to poverty. What was the kind of knowledge colleagues in the 70s were working with? What was the context? So it's really, really important that we use our ideas in the present to critique, but that we don't judge practice back from what we know now, because that's just not a fair vantage point. I've already kind of alluded to my suggestion that while social justice is close to all of our hearts, if you were to ask a member of the public or media, what do social workers do? I'm not sure that that's the first thing they're going to say. It's more likely, or it's quite possible that they will associate our role, particularly with what people might call our social control, our regulation role, child protection role, and so on. And I think in social work, we have an ambiguous relationship with this role and don't link it enough with our social justice practice. And I think that our concerns in the past about how we negotiate that care control dilemma has in some way, I suppose, affected our ability to really embrace and develop our practice into the present. And I've just three brief examples that I want to share with you. Reflecting back on Shane Butler and Shane's thinking about the development of mental health social work, which was very strong up into the 1960s, and then sort of maybe continued to develop strongly. And in the debates around the Mental Health Act 2001, Shane talks about the concern within mental health social work. The social workers were already enduring criticism as child snatchers, inverted commas, in terms of child protection, and that there was a resistance or a concern within psychiatric social work to pursue expansion if this meant expansion of the social control function. So just to kind of give you a sense, these are the important debates that our colleagues were having at different moments in time in terms of how we negotiate that care control function. Of course, that's absolutely key and central in our understanding of the history of child protection and welfare social work. And here in the Committee on Social Work report, there's sort of a statement. I think people would have different perspectives on this, but this certainly is one perspective of a view that ideally social work service was aiming to be a community-based service, a broad community service, and that there was a concern about being narrowly defined in relation to children at risk, that this wasn't a professional preference, but pressure of demand. And I think sort of it also, in some way, opened up an opportunity for social work where the main investment at that time was in relation to the implementation of the Child Care Act, looking for social work to do that care control role. And Vivian Guerin talking about probation, I think puts it at the challenges of probation, which is very much, again, around care and control and balancing what he refers to as maybe historically deserving or undeserving offenders. He describes it as a contested branch of, in a contested profession, working in a contested area, rather than thinking about it as a fixed phenomena, which is not deemed to be exclusively controlling or caring. So, you know, another way to think about this, and for us to think now into the present, learning from kind of past dilemmas and challenges, is how can we broaden our view of our legal and regulatory powers to consider how we can use power, I suppose, to promote justice and fairness. And I think we have to ask the question, how can our, inverted commas again, social control and regulation functions not be about social justice? What's not important from a social justice point of view in terms of protecting families, children, women from violence in the home? What's not a social justice issue in terms of promoting safeguarding and protecting? These are the kind of functions in terms of socio-legal actions under the law. So we have done this, but I think there's a real opportunity to make those connections more strong. I think one of the core features of social work is about mediating care control, regulation support, needs risk, and that has to be done in the recognizing that wider ecological frame I talked about earlier of identifying factors, for example, poverty, discrimination, inequality that impact lined up with individual factors. And I think the developments in Northern Ireland and across the UK, particularly in relation to inequalities in child welfare, and led by Paul Bywaters, for example, that study and the development of anti-poverty practice is a really excellent example of how to negotiate that space and develop that wider social justice perspective. But also to recognise the IASW Code of Ethics. I know John is going to talk about the code in more detail later, but to recognise and acknowledge and welcome that the code itself recognises the need to negotiate these power relations. And in its point 4, it recognises social work must be cognizant of the tensions between support and control that may arise. And so that's really helpful to have that in our code to help us in our negotiations. Now, one of the history of social work comes up as a matter of interest from time to time. I have never in my career have I suppose, experienced quite so much interest in our history in light of the final report of the Mother and Baby Home Commission. Because in that commission report, social work features very strongly, perhaps more strongly than even in some of our other historical reports around child abuse and the Ryan report, for example. But the Mother and Baby Home report, I suppose, has really, given an opportunity and a challenge for the profession to really reflect on the contested and contradictory nature of social work that I think the report reflects. Now, I'd also like to note today, it's for another day for a detailed analysis and discussion of this report, and also to note the contested nature of the report itself and people's concerns about it. So I'm delighted and would love to have further opportunity to continue the dialogues that we're having and continue to have around this. But just for today, I think it's really important to acknowledge that within this report, we have some excellent evidence of examples of social justice practice and a number of references made to where the expansion of social work, particularly over the 70s and the 80s, did lead to changes in culture and practices that were starting to recognise a more rights-based and welfare-based approach. But we also have evidence of practice that was complicit in reinforcing injustices and rights violations or not acting. And not acting isn't doing nothing, it's an act of not acting or not challenging. So I guess I'm just kind of recognising today of the number of collective and individual actions that we need to be critically considered for mutual, respectful, open and honest, constructive dialogue. And I think we need to have leadership within the profession, which is already welcomed and is already happening, and within the association, and also leadership in a wider context of how we as social workers can make a contribution, a positive contribution in relation to learning from the past, making recompense for the past. It's never too late to seek social justice, seeking social justice where we know that there has been evidence of unjust practice, and being leaders in terms of thinking out the complexities of how we do that. So I think that that's really, really important work for us to keep doing. when you look, when we look at different moments, like whether it is the practice within the Commission, that's reported within the Commission report, any of the other areas I've mentioned, that Owen has mentioned, or others might talk about today, and we do have to think about the context of the potential for social work. So those of you who are newer to the profession, you take it for granted, and I'm not saying that you take it for granted, but it is established that you're a registered profession by Coro in 2012. You have been, those of you, there are many people I'm sure listening who have CETSWA and other UK qualifications, and it is only since 1997, but it is since 1997 that we have an Irish qualification in education. But just to note that the IASW were lobbying with the IFSW since 1975 for an Irish body. The 1991 Childcare Act did lead to pay increases and recognition, and of course it brought with the challenges as well. But again, just to recognise all of our colleagues who are still working and leading, and who are predecessors, in terms of the work done to promote the status and recognition of the profession, particularly in the 60s and the 70s and the 80s. In 1972, social workers earn less than the basic clerical grade in local government, just to give you an idea about that struggle. And just to kind of refer back to our almoners and medical social workers, we did another lovely celebration 2 years ago, which I was delighted to be part of 100 years of medical social work in Ireland, it commencing in 1999. And the challenges, the work of the medical, the almoners at the time, in challenging the 1953 Health Act that I've written about in some of my earlier history book, the 1999 book, and just the amount of advocacy for the promotion of the role of social work and challenging it being pushed into an administrative role. So just to, I suppose, acknowledge that the moment in time where that work was being done, and I suppose just for reflection for us, if we don't have the power ourselves, if you don't have power as a profession, how much power do you have to try and influence change? So a responsibility for us in the present. Okay, we're not all powerful, we have a lot to do, but the profession is in a very, very, very different standing today than it was 50 years ago. And with that comes responsibility. With that new power comes responsibility for us to use that as best we can. And it may not come as no surprise to you, colleagues, that in terms of really achieving what we want to in relation to social justice and social work, whether it's you sitting today in 1980, in 1960, having the time seems to be a persistent issue for us, being over heavy workloads and the expectations from the profession. So here, Fred Powell talks about the task force on childcare, referring to the problem for social workers. Time and their skills are so often used to little purpose in trying to help deprived families whose greatest need is for things like housing, employment, environmental issues. So again, recognizing, I think there's little question about the desire and wanting to address social justice issues, but the challenge in terms of how is that done within the context of the profession. So just moving towards a conclusion, what can we learn from the past? It was quite a whistle-stop tour. I've put references at the end for whatever I've mentioned and people want to know more about. I hope there's enough material at the end, and people are very welcome to contact me if they want to find out more. But I think it's just that we have social justice as core to our practice, and that we have it as a constant in every area of our work, not just in our ideas, but in our day-to-day work, in our supervision, in what we write, in how we write it. And critical engagement with the ongoing working out of the ideas and then how they translate into practice. And I suppose I very much strongly promote the idea that it's not whether you're an individual or a collective activist in social work. It's not either, but it's both and it maybe depends on the context that you're working in. To recognise the diversity of social work, we're in a very diverse and lots of different scope. We may not all be doing the same type of work to achieve justice. There's advocacy, there's activism, there's social legal practice, a whole number of ways that we can do that. I think we need to, one of the very inspiring things for me when I read about practice, particularly in the 70s and 80s, is the amount of networking and the amount of advocacy and the amount of maybe joining up with others who are in kind of similar challenges that social workers were involved in. And I think it's really important that we learn from our predecessors and don't lose that importance of net. We need to be strong as a profession, but we also need our friends and colleagues in our other disciplines, in the community, people who use our services. We need to really think about dynamic relationships, because many of the issues we're concerned about are issues of concern for other professionals, for members of the public, for people who use our services as well. I mentioned using Uri Bronfenbrenner's work, and I found some of his later work, for example, with Morris 1996, very helpful, thinking about not just the context, which is the micro, meso, exo and macro, but also the person, the process and time around that person, process, context and time. So thinking about from a person point of view, we all need to make our decisions about our personal, how we describe and engage our personal professional stance, encouraging us to kind of embrace this notion of constant and recognize there's many, many ways you can do it. I think it's thinking about support and protection, to try and find ways to look at support and protection that aren't against each other, but that there is a duality. And I've sort of very interested in doing some current work on that with my colleagues like Pat Dolan and also Carmel Devani in Galway. Think about what we do, whether it's our practice models and our methods, to ensure we're embedding social justice. And we have to create greater awareness of the public in relation to social workers' limits and potential. We can't just be working this out between ourselves. We have to communicate it. We need to continue to work on the fantastic strength and development of the association that we've seen over recent years and develop that. It's a wonderful environment, I find, for having strength from within. And I really appreciate myself as a member feeling respected, that it's okay to have different viewpoints and that you can go and have conversations that will be constructive and mutual and challenging and all helping us towards our common goal, which is how we can do this work better. I do think it's time. I think there was a time for the gladiatorial, but I think it might be time now to leave it behind and really think more about super diversity and embracing difference and promoting the idea of citizenship, which I'll come back to. Thinking about context, the context of social work has always been a huge, huge impact, both in shaping its potential, but often limiting what can be done. And that's, no matter what point in history we look at, there's ample evidence of that. And we still have many constraints, of course we have, but I think we also need to think about how we can use the context to enable, to embrace what we talk about in terms of how we use our powers positively, to push back and push forward in context. And so when I talk about the ecological model, I think we need to kind of look at it in a critical way, be constantly challenging and questioning and in relation to that context, and to use what we might see as maybe burdensome elements of our context, like the amount of data that we now have to report, the amount of recording and the amount of administration, the managerialism. Well, how can we turn that into positive in terms of using all that data to produce information and using that information to produce evidence and using that evidence to be able to really strongly argue against unmet need, to be able to argue against people's rights not being met, to be able to really show in a concrete way that a service is not only failing to deliver, but doing some harm to families with disability who aren't getting adequate resources, to families who are in homeless services, and so on. We're creating the history of the future. Today, we're always creating the history of the future. Everything we do, like the history of social work, didn't just magically happen. It's happened by all of the actions of people that have already been mentioned, organizations, as well as moments in time. So we're all part of it. We're not sitting outside of it. I've already said it once, but I'll say it again. That doesn't mean we move on without looking back. We have to stay looking back until we've got justice for what has been done, what needs to be done in the past. It's never too late for social justice to be fought for. And I think we really, really need to kind of hold that we need to look back and take responsibility and learn, as well as looking to the present and the future. So this slide is more for you to read when I send them on, because there's a lot of detail on them, but just possible futures. What does that look like then if we're here in, I'm not sure, I don't want to put a time on it, I'd like the sooner rather than later, but possible futures, I think, definitely has to be thinking about a better public understanding that we've somehow found a way to communicate the complex, contradictory nature of social work in a way that is understood and well and reflected in our practice, that we're confident and assertive and clear about social justice being a constant in our work, and that we look at systems that constrain and we creatively think about how can we use them to enable, like use of human rights legislation, use of networking. I would love to say that in our future, we really see ourselves and feel that we're a global, national and local profession, that we see the value of learning from our neighbour down the road, and we see the value from learning from our Indigenous community across the other side of the globe, and we know that it's important to do both. I think we do need to think in terms of practice, in terms of thinking about citizenship, partnership, participation and co-production. And I guess in order to get there, we do need to go back to thinking about our ideas and our theories. And I think the future I'd love to see is where they are dynamic and they're generated between shared partnership, between practice, policy, public and academia, with citizenship, partnership and participation at the centre. There's a lot more that I could have added to that, but I'm really going to finish there to say thank you very much for listening to me. Thank you for the invitation, and I'm so looking forward to spending the rest of the day with colleagues and the learning from that. And I'll just leave you with the references that, and please contact me if there's anything that you can't access on that list and you wish to see it. So thanks very much for listening, and thank you, IASW.
Oh, thank you, Caroline. That was absolutely super. It is really hard. It's a profession of so many facets and so much experience at this stage. You've done a really good job, and thank you for being our expert. I feel you're ISWs, but our expert on the history of our profession, which I am very proud of, I have to say. We're going to take a break, but can I just remind people that I'm sure you have questions or comments for Caroline. Please put them into the Q&A, and I will be able to see them there. Somebody has had to leave us because their internet connection was unstable, and they just have asked, is the event being recorded? And yes, it is, and it will be available on our website in the event section next week. So just if any of your colleagues have had to drop off because of the dodgy Irish internet situation, please let them know that. We're going to take a break now for 15 minutes. And so we will come back at... Am I taking a break now? Sorry, I'm just... Yeah, break for 15 minutes now. Oh yeah, 10:45. So we'll be back at 11. Okay, sorry. I'm not quite as adept at Caroline at all this presenting over the internet. She did it beautifully. So we'll be back at 11, and I'll introduce the next speaker then, okay? Hello, everybody. Welcome back. I hope you had a little break there. I'm going to introduce our next speaker, John Brennan, who is currently Vice Chair of the Board of Directors, has given stalwart service to social work and to the IASW over many, many years. And he's now working as an independent social worker, having spent a long career in the Mater Hospital, managing the social work department there. John is going to speak to you about our revised code of ethics, which is exceptionally important in the scheme of things in terms of social work, and something we're quite proud of, our ethics as a profession. So I'm going to hand you over now to John.
Okay, good morning, everybody, and thank you, Anya, for that introduction. As part of our 50th anniversary celebrations, today's event is an opportunity to actually publicly launch the revised IASW Code of Ethics and the Code of Practice, which was approved at our virtual AGM last year. And we would have launched it last year, except for COVID. It's a very important, as Anya said, it's a very important documents and instruments. So it's my privilege today to speak to you about these important instruments. I'm conscious, though, that if we are meeting face to face, you'd have received a copy of these two codes in your packs. But obviously that's not going to happen. So you can download them, however, on the IASW site, iasw.ie, and they're on that site. Then they're in the IASW publications under the resources section. I will firstly give just a very brief historical background, and it's been covered a little bit by Carol and by Anya, some thoughts on the codes of ethics, the new revision that we're launching today, and then our given it's our 50th anniversary year, sort of looking forward a little bit. I have put a discussion there, and hopefully when we have the plenary discussion, we might talk a little bit more about what we do next. There have been 5 iterations of the codes as far as I can make out, and I'm still researching the very early days, and this hasn't been helped by COVID-19 because I can't get into the office, the association's office, but there were revisions in 1979, 1995, in 2004, and now this one made in 2020 to replace the 2004 one. So the first code that I have found to date, and page 1 I show you there on the screen, it was entitled A Code of Social Work Practice, and that was adopted at an unspecified AGM. There's no date on it, in the 70s, and it was to be reviewed then in 1979. And that code was 3 pages long, had 6 principles and 13 standards of practice. And you'll see on the page down here, I just took a quote from it. The introduction states, among other things, that the social worker's responsibility for relief and prevention of hardship and suffering is not always fully discharged by direct service to individuals, families, and groups. He has the right and the duty to bring to the attention of those in power and the general public ways in which the activities of government, society, or agencies create and contribute to hardship and suffering or militate against their relief. And so in this way, I feel this text highlights the role of social workers as advocates at both the macro and the micro and macro levels of activity, and as Caroline might say, at the meso level as well. And can I say, perhaps it was a sign of the times, this version of the code refers to he throughout. There's not a mention of she. So just some thoughts on the code. Social work, as this quote, I think, demonstrates, focuses on those who have needs. This involves working in the grey areas where confusion, uncertainty, and doubt reign, where our values about what society ought to be about are contentious and contested. And I think Caroline was alluding to that quite a bit in her piece. Hugman and Smith suggest the interventions of social work are contested and contentious. The ethics and values, because of that, are inherently political. Sarah Banks suggests that the growth of bureaucratic procedures, managerialism, and such like modern trends pose a challenge to social work's ethics in threatening professional judgment and decision making. So from its earliest days, issues about values have been at the heart of the association. Our codes follow Sarah Banks's thoughts that a code of ethics can be defined as a set of ethical principles and rules of professional conduct. It is, in a sense, a public statement as well as a tool for IASW members. Ethical principles then as statements of values by which we can, and I suppose must, evaluate our actions as social workers. These actions can be the tasks of social work, the methods we use, and or the organization and management of social work services. And indeed, ethical principles have implications for how individual social workers act and relate to others, particularly those who are users of social work services. And in carrying out its work, social work, at least we must recognize that in thinking about ethics, social work, like all other health and social care professions, holds and exercises power. And Caroline spoke eloquently about that earlier. Social workers are employees carrying out roles that their employers lay down, or indeed exercising powers given to them by statutory agencies. Many have authority to exercise control in the lives of people, for example, in child protection. Many of these aspects do not always chime in harmony. And this can also be seen probably in the tension between trying to maintain the status quo and seeking change. Now, Tim suggests that ethical principles are not fixed as an instruction manual. Rather, they are the basis for making choices in situations where a range of actions is possible. So in this new code then, when we were preparing both the code of ethics and the code of practice, we were mindful of Tim's. The codes contain a set of ethical principles and rules of professional conduct. The code of practice aims to be the practical application of the code of ethics. Now, while the documents may therefore look like an instruction manual, as Tim has mentioned, we nevertheless hope that it serves as an aid to decision making about choices in our daily work. And as I've mentioned, they're on the website at the moment. So the most recent version of the code has the latest definition, the International Federation of Social Workers definition of social work as an important anchor for the codes. Also, as in previous versions of the codes, the IASW, as Anya has mentioned, as a member of a member organization of the IFSW, acknowledges and adheres to the Federation's Statement of Ethical Principles. The preamble to the latest code states that it is the foundation on which to frame procedure guiding day-to-day practice. Hopefully this code respects and encourages the social worker's use of their own professional judgment to help decisions that she or he can defend rather than making decisions that are defensive in nature. We asked for input from our IASW members, and we got a very good and thoughtful block of responses which have helped to frame what we have today. And we've split the code into a value statement and a section on the principles of social work practice. And for this particular iteration, we've included a number of new references, including to the Koru Code of Professional Conduct and Ethics 2019, to the physical environment and the climate crisis. And we've also referenced the GDPR requirements, which are the bane of our lives. We've also recognized the essential role of social work in promoting social justice, which Caroline has, as I said, eloquently spoken of this morning. And in promoting social justice, for example, the principles to promote the users of services engagement and participation and self-determination. And we have recognized the care and control functions of social work practice mentioned previously, and the tensions that can arise between these. Now, I move on. I'm very aware, as I said earlier, because we're virtual, that going through the entire codes is not really a runner. So I've just taken a few examples, and in fact, I think Caroline took one of these this morning, number 4. Just a few examples of the values and the principles to give some flavour. And these, I've edited them a little bit for today's purposes. So I've highlighted just some of the key points around that. Unique and intrinsic worth that people have. Climate emergency affecting the world is significant and it is urgent. The primary focus is the needs of the person or people using the social work service. And then issues such as poverty, inequality, or discrimination that constrain services users' ability to fulfill their needs. Exceedingly important in my mind in relation to social justice, and then the issue, the piece in relation to social workers as advocates, but advocating with and on behalf of and engaging the users of the service to facilitate them in contributing their views to such developments. And I think that's really, really important. That we continuously look for ways to engage with the users of services. And then I think this the principle 4, the inherent tensions, and Caroline has mentioned this, between support and control that may arise. And I think it is in recognizing that we have those two roles, and the tension is how we manage it. And I think Caroline was mentioning that. So let me see that. Moving on. So yeah, just before I go, I want to just before I move on, I want to just acknowledge and thank Danielle and Clina from the office for their huge efforts in the preparation of these documents. And what you see on the web is their work in putting it together in a readable format, and also in keeping me and the group that we had on track to make sure we were doing some work and giving us some timelines and whatever, and also in working with the people who were giving us their thoughts and comments. So thank you very much, because they were really very, very helpful. Then just moving on, I guess I'm looking forward a little bit. So Hugman and Carter argue the challenge is to integrate ethics into practice so that it provides the basis for good practice. I won't go into what good practice is, but for today, but and that is the challenge, I think, so that they're not sitting on shelves somewhere. So our task is really, I think, to strive to embed the principles into daily practice in a meaningful manner. And for me, and for certainly for a period of time, the recent past, I've grappled with what do we mean by human rights and social justice. What exactly do they look like? And I think we must understand, we first understand the meanings of those terms, if you like, in order to help achieve them. And I guess I think I will be going back to Caroline about some of the thoughts that she presented today to help me with that. And I know at a federation level, where we're working in Europe particularly, that social justice is really important to be at that macro level, and that we need to be clear ourselves in what we mean when we speak of social justice. And is there an actual contradiction with human rights? You know, so there are questions that perhaps I hope I will pick up again, and people might have some ideas even in the conversation in the plenary session. We believe that these codes are living instruments, that they should be reviewed regularly to revise and update as necessary to meet the needs of the time. And in that sense, they're always a work in progress. So it's important that they're not consigned to gather dust. And I think in that regard, perhaps we should provide a timeline for review. I know in the past when I've spoken and being involved in the association, yes, in previous iterations, we said we review them in 3 or 5 years, and it kind of runs on. But maybe we should actually put a timeline and adhere to it. And then I just wondered, should we survey our members in maybe 12 months' time or 18 months' time and just see what use has this code been to them? And there may be other thoughts around that as well. I had a question for this, but hopefully we can maybe take it up in the plenary session, because we're going to move on straight after me. But is there a contradiction in the codes between the prescriptive rules on the one hand, and then being encouraged to use the codes as the basis for decision making? Does the one militate against, does the prescriptive bit militate against using professional judgment? It's a question I have. It's a maybe somebody might throw in some comments on that at the plenary session. So that is my lot. Thank you very much for listening to me, and I look forward to the plenary session.
Okay, thanks very much, John. We get lots of questions in relation to dilemmas that members have, and you know, I often suggest that they look at the ethics, the Carew ethics and our own ethics in IASW, to decide if, you know, if what is being demanded of them or what action is required sits with those ethical principles. The next speaker I want to introduce is very, very pleased today to have Rory Truell with us. Rory is the Secretary General of the International Federation of Social Workers. But more than that, he's a really good friend of Ireland. He originally was born, not that you know it from his accent now, but he came from rural Newry, and has strong links, family links and family ties throughout Northern Ireland. Which he would say gave him the foundations for being a social worker. So he's been living in New Zealand for over 40 years, and he's now based in Switzerland for the International Federation. Works worldwide with government leaders, national social work organisations, frontline services and international development agencies to develop cooperation and partnerships with communities and populations for sustainable development and social transformation. So I'll hand over now to Rory. Thank you for being with us today.
Oh, thank you, Anya. What a nice welcome. Hello to all the members of the panel, to all the board members of the Irish Association, to the team in the background who are doing a wonderful job, and of course, to all the participants in the conference. And on behalf of IASW Global President Silvana Martinez, the IASW European President, Anna Radulescu, the global team, all IASW members, happy birthday and congratulations on such a significant 50 years of contribution from all of us. Well done to you, and I hope you're having a wonderful day in celebration of this milestone event. What an achievement you've made in building a strong and valued profession over the last 50 years, a profession that is an essential pillar to social development and social justice. At the time of your birth, 50 years ago, Ireland, of course, was still plagued by poverty and the consequent intergenerational mass immigration. I'm sure that many of you in the conference can recite the family histories and stories of pain as perhaps your aunties or your uncles or your cousins or members closer to your family had to leave to find work. And these experiences have perhaps shaped Irish social work and equipped it with an understanding and an empathy and an insight into how others experience those pains now across the world. And also these experiences that you've brought forward from your profession internationally give us all the opportunity for reflection as we grow as a profession on what and how we can be more direct, what role we can have in averting more directly the trauma and the pain that is caused by poverty and migration. So today, as looking through your agenda, I can see that you're also reflecting on many of the challenges that you have before you. But please don't lose sight of how far you've come in 50 years and how now each generation has a better future and more possibilities than the generation before it. Seeing our past journey helps us to look at the mountains that we have ahead of us and see that they're easier to climb. So congratulations to the current leadership of IASW, the past leaderships, and all of the members that have contributed to the incredible journey of social work and working towards social justice. Today I'm presenting on behalf of the IASW President, European President Anna Radulescu, and myself. Anna's listening, but she's unable to join us as a presenter today because she's in multiple commitments. I know she's actually speaking at another conference right now, but she wishes all of you very well. And today I wanted to address the conference theme, social work and social justice, where now. And I thought it would be useful to, like the presenters before me, to have a little look backwards and then a little look forwards. So the presentation heading that we have right now is, how has social work's understanding of social justice changed over 50 years? And what comes next? A global perspective. So I want to start by contextualizing social work and social justice over a period a little longer than the 50 years and start with the roots of the modern profession of social work. Social work has always been driven and deeply connected with social justice and social reform. The IASW archives go back to 1847, when the first International Congress on Prison Reform proclaimed the necessity of establishing contacts between different countries to improve the working classes' conditions and their conditions for the indignant poor. But unfortunately, there was no mention of that time, 1847, of the potato famine, and little discussion about the effects of colonization across the world, which normalized different forms of genocide and dismantling cultures and people's humanity. The overt drivers of mass trauma and dislocation, which still plague many Indigenous communities throughout the world today. Our forebears did not stand by, however, as they observed such suffering and wanted to respond to it. And they co-led many, many strategies globally, struggles such as the abolishment of slavery, the right for women to vote, which in those days were viewed as completely revolutionary acts. They also held international conferences in the late 1800s where various resolutions and recommendations were made, including on child welfare, where social workers at that time pushed for standards such as that asylums should not contain more than 100 children, that children under the age of 18 should be prohibited from working at night time, that there should be limitations on the hours that children worked, that workplaces should have a duty to pay for the education of children, and that there should be opportunities for deaf and blind people to be able to work, and those work environments should be created. All these social reforms that they pushed forward were long before the creation of the United Nations and the concept of international human rights. Yet the above international reform conferences that made these conventions in the late 1800s and early 1900s worked with the protest movements that were evident in those times and were able to push these strategies forward. With today's insights, however, we can see that these early days of the formation of the modern social work profession could have been significantly improved, and its impact on social justice could have been improved if there'd been more attention to the connection between the different forms of injustices, the different drivers of poverty and destruction and trauma in people's lives. Injustices fueled not only by colonization, but also expanding patriarchal beliefs, industrialization, philosophies that promoted individual merit for self-improvement rather than understandings of interdependence, equality, and working with people rather than working for people. Social work was, however, not the only movement not to recognize the complexity of multiple injustices working together. The trade union movements in the West, while making enormous gains for working men's conditions, almost seemed blind to the oppression of women and to the oppression of people of colour. IASW, however, recognises that there are many strands and roots and elements that equally have formed and shaped the social work profession. Indigenous social workers have demonstrated the massive adverse negative effects where Western models of social work practice have contributed to the destruction of their cultures, dignity, and customs. And such colonial approaches are now or have been replaced by Indigenous cultural approaches to social work that have had far better results and outcomes for their peoples. But also, such Indigenous approaches have also been trialled and used across Western countries with a far greater level of success than the models that we originated with. One example of this is family group conferencing. And I'll also speak a little later in my presentation about the current global agenda theme, Ubuntu. Over the decades, other influences have also shaped the modern social work profession and its understanding of social justice. Each of these are important traditions. The struggle for democracy in various countries became a struggle internationally of social work for people to have the democratic right to vote. The civil rights movements in the 50s and 60s, particularly in North America, but also in Ireland, in Northern Ireland, had a huge impact in identifying that our profession is connected to people's struggle for their voice, their dignity, and their progress. Each of these are traditions that are rich and make fertile grounds that contribute to make social work what it is today, and place us well as a profession to meet the challenges and social problems of the future. But it's also wrong, as other speakers have noted, not to acknowledge, we must acknowledge the bumps, challenges, and the mistakes that we as a profession have made in our journey. It was of great interest internationally for the international profession to read IASW's apology on the profession's failings to uphold the basic rights and to challenge injustices in relation to the Irish mother and baby homes. The Irish profession is not alone with social work being complicit in unjust practice. Recently, the Canadian Association issued an apology to the Indigenous communities for their part in the forced removal of children from the First Nations people. Likewise, the Australian Association has apologised for their role in the profession's taking of what they call a stolen generation. The list goes on. In recent years, the German Association has reflected on its role in being complicit with the Nazi regime. And even today, there are concerns and debates and questions about some national associations failing to recognise the rights of persecuted minorities within their countries or within their country's control. Such apologies as the Irish, Canadian and Australian associations have made can be essential building blocks, work to rebuild trust with communities and populations that were affected. The challenge, of course, in addressing these histories is how do we continue to work with those affected communities, including the perpetrators of the abuses, as well as the victims of the abuses. One of the particular challenges that social workers face in these situations is whose version of social justice do we work with? And ideally, how do we support differing sides coming together to develop a shared understanding? Despite the challenges we have faced, the mistakes we have made and are learning from, there are many, many more extraordinary examples of social work supporting and leading social justice outcomes. About the same time that the Irish Association was formed, social workers in the north of Ireland were bringing divided communities together. This work has only just come to light because in the past decades, much of it was carried out under the radar because it was just simply too dangerous. But in these safer times, community members themselves are speaking out about the role that the social workers played in the peace process, in the way that they brought communities together across a violent divide to see a new future, which gave them hope. Perhaps some of you in the conference will have had far more direct experience of this. And if you do, IASW would really like to know from you and hear from you and learn from you in relation to some of those experiences. The questions on the ideas of social justice and how we work to support shared understandings of social justice are, of course, on the minds of every practitioner when they work with a family that's divided or a social worker that works in a divided community. But they are also now becoming more central questions in the context of global development. They're questions that now sit on the tables of the United Nations, many of the other international INGOs, in terms of how to bring people together to move forward, not just as a top-down perspective, but as a united perspective in terms of achieving social justice. Our approach in social work is quite significant to this. We've made some shifts in understanding globally that have become quite important and central to this discussion. It might be just a small matter of words, but it has a big impact. In recent years, social work now uses the words, we advocate with people or with marginalised communities. In the past decades, perhaps we used to more often say we work for marginalised communities, for or with. The change of phrasing to working with recognises the strengths of all people in contributing to their own development and towards social justice. We recognise their contributions to solutions and also their responsibility in being a part of establishing a solution. Likewise, the profession is also re-establishing and reclaiming its approach of community work and community development, an approach that was very familiar to many people in social work throughout the world until the era of Reagan and Thatcher, and their attempts to disrupt state welfare solidarity. We've seen, particularly under this pandemic, huge massive return to having to use a community development model. And it's been accelerating the profession's response to reclaiming its traditional roots. If anyone wants examples of how social work has been doing this under the pandemic, there's a free book on the IASW website called To the Top of the Cliff, How Social Work Has Changed with COVID. And in there you'll see lots of examples, stories of how we've emerged out of this, or emerging through this pandemic, by reclaiming these community development roots. But more changes are also happening in social work and how it understands social justice as a future issue. Before the United Nations Sustainable Development Goals, the global profession of social work recognised the need to integrate social, environmental, and human rights into an integrated package that cannot be separated. The platform was launched in 2010, and some of you were there. I know some of you were there, under the name of the Global Agenda of Social Work and Social Development. The Global Agenda also brought with it a turning point for the social work profession, a massive expansion of growth and identity, and indeed a focus in our attention on the integration of the social and environmental justice. As a consequence, members or social workers across the world saw the messaging that we created globally and realized it resonated with them, and they wanted to be a part of it. So across Africa, Asia Pacific, and Latin America, and also some countries in Europe which didn't have social work associations, over that decade, they came together, they formed national associations, they formed the kinds of codes of ethics that John just showed us. They wanted to be a part of an international movement that they saw as being really important. This changed IASW's country membership list from 80 country members to 143. And as the members of the board will know, in the Irish Association, there are now 3 other applications currently being voted on. So the list keeps growing. And from these new members came new ideas and new ways to express the practice and international principles of the social work profession. Some of this was reflected in the 2014 revised global definition of social work, which has now been unanimously voted on by all members. There were 4 differences between the 2014 definition and the earlier 2001 definition. I just want to speak about 2 of those differences. One is the addition of the words collective responsibility as a principle that sits alongside human rights. And the other is Indigenous knowledge as an equal body of thought to other forms of knowledge. The addition of collective responsibility alongside human rights emphasised that in all of our daily experiences, rights can only be realised if other people around us support our rights. Supporting the rights of others that live within our family, supporting the community. That's my coffee machine. My apologies, we'll be over in a minute. Supporting the rights of others in the community, supporting the rights of people in your workplace, supporting the rights of the people that make the products that we buy, supporting the rights of their children to have education, It centres the concept that not only governments and their policies are defenders of human rights, but it is also everyone's duty to support the rights of others, making us all responsible for one another. The other agreed concept across the social work profession also fits well with this. Recognising Indigenous knowledge equally with other forms of knowledge. And this is perhaps best illustrated by the current global agenda theme that we have called Ubuntu. I am because we are. Ubuntu and other Indigenous knowledge philosophies were not recognised by Western societies, and they were actively suppressed. We all know the philosopher's name, Immanuel Kant, who was one of the leading and most influential philosophers of Western Enlightenment. But he concluded, through his scientific analysis, that African people were incapable of having a philosophy because they were intellectually inferior to white people. He also drew that analysis for people in Asia and all non-white people. They were incapable of developing philosophical ideas because they didn't have the same intelligence as white people. It's quite explicit about this in his writings. Other philosophers of the Western tradition agreed. Hume and Hegel had similar views. Such cultural and genocidal racist views are therefore now written into the baselines of Western philosophical thinking, which is now global philosophical thinking. Instead of having a mix of philosophical traditions, we have a dominant tradition which emphasizes individual merit rather than the indigenous or Eastern philosophical frameworks, which emphasize a holistic perspective, such as Ubuntu does. Ubuntu as a philosophy is based on the generic life values of justice for everybody, responsibility, equality, collectiveness, relatedness, reciprocity, love, respect, helpfulness, community, caring, dependability, sharing, trust, integrity, and social change. It emphasizes that people's identities are continuously developing in the context of their reciprocal, I always struggle with that word, reciprocity, relationships with others, and thereby, through supporting and nurturing others, one's own identity and life quality is enhanced. There's something a little familiar to me about Irish society, and especially rural Irish society, with this concept, that one becomes revered in your community because of what you do for others, not what you do for yourself. When a practicing Ubuntu social worker is confronted with a problem, she does not seek to analyze it into components or parts, but rather she will ask, in what larger context does this problem reside? Individual identity under Ubuntu is not denied, but it is defined as someone who and how they contribute to the wider whole. These values, I hope you agree, or I think you probably do agree, resonate really closely with social work principles. But they are not always and often understood by other global actors that purport to defend human rights. Human rights are often understood in the context of individual right rather than a blend of rights between individuals. This idea of bringing perspectives together of divided peoples and of the environment. As social workers in the West, we experience every day and find ourselves in a struggle with bureaucratic systems that enforce this model that comes from the full Western philosophies I spoke of. We're asked to do case management, which is about building the individual capacity of the person rather than seeing them in their interdependent context and how they can develop their humanity through contributing to others. So these are ideas, I believe, that are going to help shape social work's contribution to social justice in the future. These ideas that we've agreed in our global social work definition, these ideas that others in our profession are bringing forward from different philosophies to complement our own, are ideas that will help build our understanding of how to shape social justice. Yesterday, IASW co-published a statement with our counterparts in global health. It read, if you had a chance to read it, it's on the IASW website, but the headline reads, 160 million frontline professionals, which is social workers and health professionals, request the leaders of G7 and G20 summits to engage in co-design, co-building effective universal intervention in the current COVID pandemic. And we further propose the development of health and social protection systems that address inequalities. The idea of co-design and co-production with people and communities is of course familiar to us. This is our language. But it is now growing as a concept for other global actors, such as our health colleagues, International Council of Nursing, International Council of Medicine, these enormous health professions. As they, like us, want the world to emerge from this pandemic with a new set of values and a new set of methodologies to achieve those values. We are also right now in discussions with the United Nations agencies who have begun to see social work as a key reference point for social development. They too are expanding their embrace on ideas of social justice and development and how these need to involve the communities that we work with. They need to involve the world's citizens and build from their experience upwards, rather than the domain of rights and justice being defined from a downward perspective. So we are seeing new movements, and we're at the beginning of new movements, which this pandemic has helped build as people want a new world at the end of this process. And we are on a new journey where social work and the ideas that we have had working with people, co-building and co-designing with people, are now taking enormous traction in other parts of international development. Many of you and I have contributed to this agenda, and even this conference, focusing on the future of social justice, illustrates our forward-looking approach. We've come a long way in 50 years of the association's lifetime. We have learned on this journey from the days of the early social reformers, and we are continuing to learn, not just from our own experiences, not just in our conferences like this, but from the people that we work with, but also from our colleagues across the world and the communities that they work with. From this, we are now promoting co-design, co-production, working with people at the family level, at the community level, at the societal level, and working to connect these issues at the global level, so that we work towards a concept of evolving and shared futures. So IASW and I and Anna want to encourage you on the milestone of the 50th anniversary of your association, and to celebrate the profession's enormous contributions, not just to itself, but to the growing influence that it has on the global development for social justice. Happy birthday, and thank you so much.
Okay. Okay. So you now, thank you, Rory. That was really interesting, and I suppose poses some of the dilemmas. I'm absolutely delighted to hear that international membership of IFSW has gone up to 143. That's a super a super achievement. And I suppose perhaps one of the good things about us all having to go virtual. It has allowed a lot of people with much fewer resources come into the fold. Okay, so we're very happy to take some questions now. You can put them up in the Q&A if you haven't already done so. I suppose, you know, if I could just kick off with one question that came to me there while Rory was speaking. When you spoke about co-design, involving communities, moving to a new language, you know, which uses, I suppose it's very kind of Irish Disability Services have for a long time spoken about people with disabilities, that everybody is a person first, and now talking about, you know, communities in that way. And I suppose one of the problems we find here in Ireland sometimes in social work is that these ideas going forward, these things that we have promoted, get taken over by others who go, oh, this is the new way. And we're going, but hold on, social, and we get excluded from what has been our practice and our ethics and for a long time. I just wonder if you have some comment to make on that.
Me?
Yeah.
I know what you're saying, and it's really wonderful in one sense to see other professions using the strengths perspective. So they've claimed the strengths perspective as their own. But I'm also aware that social work borrows and learns from others all the time, and that's part of the process. Our challenge, I think you've articulated it really well, is to help build shared values across different professions so that they're recognised as social work and as nursing and as primary care values. And many of them have come from social work because we're a very, very good profession at learning from the people that we work with and sharing that information. We're a very open profession to new ideas and in sharing them internationally. But in the end, who started the idea is actually the people that we work with. It might be someone in the disability sector that works in our service, but they might also work in a nursing service, and they might also work in an occupational therapy service. So it's really their ideas. So we've got to break down the silos between the professions and just agree on these shared values. I think it would help a lot.
Okay. I have a question here for Caroline. Caroline is from Liam O'Sullivan from Care Alliance Ireland, and what Liam is asking is if you have any views on the potential for the role of technology in supporting social work, that he's referring to that slide where you were talking about the macro, meso and micro, to affect positive change in the lives of our clients.
Thanks very much, Liam, for it's an excellent question. I mean, I think we've learned, as Rory was speaking, we've learned a lot about the potential of technology in the last year. And I think there's a few things that come to mind. I mean, one is our access to wider international learning. I think that has been transformational for us to be able to join groups or to join different opportunities where we have a connection. It doesn't equalise, but it certainly deals with some of the issues around access to knowledge. I think in terms of thinking about it from the point of view of young people, I think one of the key things that maybe, certainly for myself, is becoming more proficient for more experienced and long established professionals to increase and update our proficiency in relation to knowledge around technology, because in terms of linking with young people and young generations, there's huge potential. I think our way forward, as Rory was saying, in terms of it's about finding ways to work together and to embrace methodologies that work for all of the communities that we work with. So I think there's a huge capacity there for technology to equalise intergenerational relations, for example. And I know yourselves, Liam, and other organisations are doing fantastic work already in that way. So I hope that gives some useful response to your question.
I have a question here for John. If sorry, the joys of working off two computers here. If just to say, if John could comment on the link between the Code of Ethics of the IASW and the Carew Code of Ethics, a very important question in many ways around our
Yes,
Code of Ethics.
Yeah, we did look at the code, obviously very clear, very in depth when the Carew Code came out. But we felt that we should have our own code, but what is in the Carew Code of Ethics is we agree with what is in that code. And what we are doing is in our code, because we had this conversation maybe 2 or 3 years ago, would we just go with the Carew Code when it was being revised? And there was a debate in the association around that, or should we have our own code? I was always of the opinion that we should have our own code. But I think when the Carew Code came out, we felt, yes, it's generic in many respects. It covers many professions. And we needed to be very clear around, have the definition of social work in there. The IASW definition that Rory has spoken of and I mentioned, that should be in there because that's the anchor. And also the issue of social justice and human rights being very front and center for everything we do. But in our own codes, we have clearly stated that our members need to adhere to the Carew codes. So I see them as sort of complementary. I don't see them as oppositional. I hope that might answer the question.
Yes, we can't have one without the other, really. Once we became registered with Carew, which was really important, we've got to sit with that.
I think I was mentioning that the code, from my point of view, it's a work in progress, and with each iteration we try and refine it a little bit. And I think that whole issue around professional judgment and it being a basis for decision making around the choices that are out there is really important, that we don't end up just because of the bureaucracy and the managerialism that we've mentioned already, swamps us into becoming tick box people, and this rote tick boxing that we've covered things, but that we are encouraged to use our professional judgment in the decisions that we make, and in working with people, the people who use our services, and also with other professions. And I think that's where I'm hoping we'll go in the next period, is that we will refine that even further in the next iteration, so that it becomes it becomes embedded in our practice. It is what we are.
I think that's really important, because nothing stays the same. And a former boss of mine used to say, I never give excellent when he was doing staff appraisal stuff, because if you reach excellent, you're standing still. Yeah. And if we ever reach an ultimate code of ethics, then we've stopped learning.
Yeah. You never give yourself 10 out of 10. Yeah. Always give yourself 9 out of 10, Yeah. Anya, can I don't want to hog this, but could I just comment? Just comment on the previous question.
Yep.
Because I think it's really important that we push that the people who use our services have access to digital technology, and this pandemic has shown that for some people and some groups that has been a real challenge, and that we really need to push, and certainly from a federation point of view, we need to be pushing it at a European. In Europe anyway, with the EU around the resilience and recovery programs that they are coming up with, and where money goes in terms of enabling people to be able to engage with technology. Sorry, I'll stop now.
That's fine. sorry, I just this question again relates, John, back to you. It's a question around, am I right in thinking that the Carew Social Work Code is to be complied with whilst the IASW code is best practice?
No. I think if that was the case, we'd be in trouble. I think they have to be read as complementary.
Can I add a comment to that?
Yeah.
So it was the IASW code was the one you referred to, right? So IASW doesn't have a code of ethics in the way that a national association does. What we have is an agreed set of principles, which every code of ethics around the social work code of ethics needs to comply to those principles. And that's what sets us together as a global profession. Is that we have the principles of the profession in common. But we don't have a code of ethics at the global level because each country also has unique ways of interpreting those principles. So we might talk about sensitive management of privacy, but that for a code of ethics in an African country may be interpreted really differently to a European country in a way which might reflect those different philosophies that I spoke about. One being the individual is located in the context much more openly in their community, where in a context in Europe may, or perhaps in Ireland even, it may be that more privacy is expected in the culture. So we don't have a code of ethics, we have a set of global principles.
I have another question here on, and it's for any panelist who wishes to comment. Would any of the panelists like to comment on Paul Michael Garrett's point and exploration of the matter that Carew removed human rights in the Carew Code of Ethics?
I'd like to, in terms of following on from the discussion just about the relationship between the Carew Code of Ethics, the IASW Code of Ethics, and the IFSW Code of Ethics. I think what's really important is that we continue in our work going forward of looking at how we can influence the development of these codes, in relation to feeding back into core developments. And I think we remember that we started in 2012 as a registered profession, and now we're maturing. It's 2021, so we're nearly 10 years in. So I think it's probably a good opportunity to think about the code of practice of a registering and regulatory body, the code of practice of a professional association, and then the code of practice of an international federation. So I think it would be a great opportunity for us looking into the future of looking at the relationships, the tensions, but also starting to kind of move into that more mature space in terms of looking at how one can influence the other. So I think that's sort of a challenge for us going forward. And certainly this work that's being done today around social justice, I think is really an excellent moment and point for us to really focus in on how we take that forward. And just maybe, I was thinking a little bit more of Liam's very good question earlier, back to the issue around technology and promoting rights. We have a real opportunity in the year, more than the year that we've had now, in collecting, all of us in our context of collecting evidence and data about where people's rights and potential for experience of injustice were violated because of lack of access, or because, if we are really, some people are doing this work already, but the more we can collect good data and evidence from each of our day-to-day practices, identifying who was left out, who couldn't be reached, who suffered most. And that kind of data, I think, is what we can really bring to meaningful, kind of critical dialogue in relation to going forward around justice and rights and the relationship between that. So that's my contribution.
Thank you, Carol. I think that's a really, really good point to end the session on, because we go forward in the afternoon looking much more towards the future, and we're looking towards the next 50 years. I'm going to thank our panel this morning, Caroline McGregor, Rory Truell and John Brennan. It has been really stimulating, really interesting having you here today, and your contributions have been excellent, absolutely. We're going to break now until 1 o'clock, and we're going to break until 1 o'clock to give people an opportunity to get some lunch, and we will see you all back here online at 1 o'clock. now I'd like to welcome you all back to the afternoon session of our annual conference. And we had a wonderful morning this morning, and very much in some ways looking in true reflective style, looking back to the past, to what's happened over the last 50 years in social work, and where we're heading for the next 50 years is really where we need to focus now. And we learn from all of the lessons of the past and all of the experience of the past. I just want to mention that we have had some lots of guests here today, including Anna Radulescu, who's the European president of the International Federation of Social Work, Bernard Gloucester, CEO of TUSLA, Mo Flynn, the new CEO of Carew, our registers, and Suzanne Connolly, the CEO of Bernardo's. They're just 4 people I picked out. There are lots more, but they're just 4 people that of stakeholders and people that we work closely with that I have just wanted to mention for now. We're moving on now to our next speakers are Dr. Coletta Daly-Kenny and Dr. Hilda Loughran. I'll introduce Hilda first, and they're going to speak to us about the IASW's anti-racism strategy. Hilda is the Associate Professor in the School of Social Policy, Social Work and Social Justice in UCD. She's also a member of our board for the last number of years, and a former editor of our journal. Hilda, with Cleana Murphy, the CPD officer, initiated the IASW Talk Time, which is a peer discussion group in March 2020 as a response to the COVID situation. And it was out of that that Hilda became involved with the Anti-Racism Forum. Coletta is a Carew registered African-Irish social worker, educator and researcher, currently based at Dundalk Institute of Technology. She's a board member of the Irish Association of Social Workers, again, for many years now. And she's on the editorial committee of our journal, and a reviewer for other international journals, as well as an active member of our anti-racism advisory group. Her research and teaching interests have a bias towards culturally competent social work practice with various ethnic minority categories such as immigrants, asylum seekers and refugees. Her particular focus is on how the intersecting discourse of race, racism, culture and culture come to bear on their human rights in the context of social citizenship and entitlements. She has a an amazing track record now in this work, and she also has she does everything she does with fantastic good humor, and therefore I would like to hand over now to Coletta and Hilda, who will speak to you for the next 15 minutes or so.
Hi, I'm delighted to be here, everyone, and yeah. I just want to alert people that this isn't an academic presentation that I'm making. I'm really taking this opportunity to reflect on the experiences that I've had, and in particular in working with Coletta. And you can see in the background that I have pictures of my other colleagues who are part of the IASW racism group. So I suppose just to start off, I want to say that I was very reluctant to speak because as a white Irish woman, I've lived a relatively privileged life, and I haven't experienced racism, and that made me quite reluctant to speak. However, I agreed to talk about my own journey to this point and to really sort of share some reflective thoughts about that. So not going to go back into my whole history because that would take a long time, but just as an Irish person of a certain age, I grew up in a country that was considered to be quite a monoculture, really, and I was unaware of racism and discrimination based on colour. However, even as a young person, I was aware of difference, and I understood quite early on that people were treated differently because of gender, ability, class, ethnicity, and religion. And so I often thought that for what was supposed to be a monocultural society, it seemed to me that we gave difference a lot of power, and not always in a good way. it was a long time before I learned about conscious and unconscious bias, and how they support prejudice and discrimination and racism. So as I've not experienced racism myself, I want to talk a little bit about developing my sense of what it's like to be viewed as different. And this isn't in any way a comparison, but it's just my own reflections on it. So reflecting on at least some sense of understanding of being treated differently is important to me. And it's not about comparing experiences, as I said, but it is what prepared me to be able to listen to other people and to listen to other people's experiences. More recently, as a woman working in what's been recognised as a male environment, this has brought its own challenges. But long before that, I learned about difference. One of my first memories would have been that I can remember as a teenager overhearing one of my teachers talking about myself and some of my friends in school. We were a gang of 4 at the time. He was waiting for us to arrive in school and to help out with some weekend function. And that was something that 4 of us were often asked to do. We were about 14 or 15 at the time. And as you might expect, we dawdled in and we were, as we thought, on time, but we were probably a few minutes late. As we rounded the corner of the building, we heard her complain to somebody saying, oh, the girls, I'm naming the estate that I came from, are always very unreliable. And that idea stayed with me, that somehow because of where I lived, that I was a lesser person. In later years, my family were sharing tales of school, and my sister told me of a day in economics class when her teacher, in discussing socioeconomic disadvantage, said that children from lower socioeconomic backgrounds, and again, naming our housing estate, that they could not be expected to get good jobs. She was very upset about that at the time. And even as we talk about it now, it seems quite upsetting. Mind you, her teacher might have been better served to prepare his all-female class for the challenges that would face them in gender discrimination in the workplace. Then when I moved to Dublin, the name of the housing estate that I grew up in meant nothing to anybody, and it was almost like a freedom. But I quickly discovered that this experience of being viewed as lesser simply because of your address wasn't unique to me. While I left behind this in the anonymity of Dublin, I discovered that many people that I work with had stories of not being able to get called for interviews, never mind get jobs, because once they had given their address, they were seen to be unsuitable. I suppose another thought I had was that as a country person coming to Dublin, I could even see my experiences as being different. And it wasn't just about being a culture in a Dublin environment. There are a lot of stereotypes that go with that as well. So again, just another example of how we can make things different when really there is no difference. So in order to add a sort of a personal note to this, I thought I'd tell you a small little story about being a culture in Dublin. So I'm going to tell you the story and then I'll tell you what happened next. So I remembered when I first visited Dublin, and when I first started to work in Dublin, just visiting tenements and the shock of learning how people live in such crowded conditions, visiting older people living in isolation in the middle of the city, and working with young people dependent on drugs, all lives that were so much different from the life I had led in a small country town. I had a sort of funny experience, which this is my funny story, about my accent, which is a Meath Louth accent, in case anyone hasn't spotted it. And somehow or another, I realized I began to hope that my accent was no longer going to be obvious. And I don't really know why, but I've thought about it just because of talking about this today, and I'll share some thoughts with you. But I think it's about my identity and seeing somehow that I was different as a culture and that my accent gave me away. Then one day in the service that I was working in, the clients were discussing with me that they had been puzzled about my accent because they'd never heard an accent like it before. And they concluded that I was from Foxrock, which you may know is known as a very prestigious part of the city. And the reason that they concluded this was because they didn't know anyone from that area. And so they guessed that must be why they didn't know my accent. But they were talking to me because they had a little problem, which was the only problem they could think about was that didn't fit with the image of me being from Foxrock, was that I was driving an old banger of a car. So we all had a great laugh about it. So interestingly enough, I told my friend I was going to tell you this story, and she became concerned that people from Foxrock might be offended. Then I began to think that my former service users might be offended, or that people from Meath or Louth might be offended. So what seemed like a funny story, which I saw myself as a joke, became something to reflect on to tease out what underlying message of unconscious bias it may display. Even asking myself why I wanted to lose my accent, which I'm now proud to say I didn't ever lose, as you can hear. And it was just so interesting for me. And I even began to realize many, many years ago, I made the decision to drive a loud registered car. It's almost like somehow or another, I became comfortable with my identity. And I can find it stressful at times and at times exhausting, trying to make sure that I say the right thing and that I don't offend. And that simple story was a real example to me. I was just completely oblivious to the fact that anybody might be offended by my story. But being conscious and reflective is about working on myself, and it should take up time and energy. It's an important aspect of the person and professional I want to be. The important for learning for me in all of this is not about my feeling challenged when I reflect on bias, but it is about people who are experiencing racism in Ireland and how exhausted they must be. Many face sometimes daily events which may go unnoticed by others, and more obvious events noticed by but not challenged by others. Coletta talks about them as microaggressions, and we'll come back to that again. Discrimination and racism are not funny, and clouding the issues with humour or minimising them, ignoring them, is not helpful. It's important to eliminate my own unconscious bias, but rather than just eliminating it, it's about remembering that everyone has biases, and I need to be aware of them and reflect on them. It's important to me as a member of the social work profession, where our mission includes a commitment to social justice, which we've been talking about today. Maybe that's what drew me to social work. I don't know, but I do know that discrimination and prejudice has always upset me. In my work with people who use drugs, for example, I witnessed discrimination and negative use of them. When I took my first job in addiction services, some people said to me, why would you take that job? People who use drugs never change. That hasn't been my experience at all. So I just want to move on to, when COVID hit and Cliona and myself decided that we would set up talk time in a response to trying to support social workers who were experiencing lots of difficulties, not just because of COVID, but at a time when the profession was being discussed as were we essential or were we not essential. And there was a lot of hurt and upset among our peers, and the support group really, really worked very well. Later on, I suppose into 2020, through what happened in Minneapolis, the world was reminded that Black Lives Matter. Closer to home, some of our colleagues, however, were talking about their experiences of racism, and we recognised the need to respond. Coletta asked us to dedicate a number of talk time sessions to discussion of racism. These groups were both moving and disturbing. I was very upset after most of them, where stories of the struggle against racism, comments and actions were talked about by the participants. These microaggressions wearing people's spirits right down. These are not my stories to tell, but they are stories that we all need to hear and respond to. As I listened to my Black colleagues share their experience of racial abuse, verbal intimidation, lack of empathy, sometimes from colleagues, and in some cases unsupported by their workplace and by their profession, I felt such a sadness that the profession I'm so proud of, and which I see as dedicated to social justice, could have failed her colleagues so badly. Excuse me. Thanks to Coletta, the IASW agreed to set up an anti-racist forum. The forum has met on a number of occasions over the past 6 months, and we've agreed on 3 streams that need attention: social work education and research, social work practice and CPDs, and advocacy and policy. And I noted that Rory said, we need to advocate with, not advocate for, and I really think that's so true. Coletta will talk more about this, where we are right now with this, but the main message is we need to do this together. For my part, I'm honoured to be viewed by my colleagues as an ally in this struggle. I had a beloved aunt who once told me, if you want to change things, you have to change it from the inside out as well as from the outside in. So the IASW is committed to addressing anti-racism and discrimination, and we are calling on our members to support and act with us to implement the anti-racist strategic plan. So far, the response from the membership has been really encouraging. When we asked for extra help, we got a great response. Thank you. There is work to be done, and Coletta is now going to talk about that.
Thank you, Hilda. Thank you, everybody. Hilda nearly got me going there with the whole idea of thinking about the impacts that racism has, the lived experience of experiencing racism. I want to thank the IASW for allowing us the space to address a very difficult issue. But I think social work is about being comfortable about talking about difficult issues. We heard in the talk time sessions about social workers' experiences of racism at work and how they experience it even when they are with service users, when they're working with service users, and when they approach managers putting the issue forward, and managers who don't know how to deal with that. But we are where we are today. We have been given a wonderful opportunity to be able to address some of those issues. And the anti-racist strategy is really an action-oriented strategy that's giving us the space to do so. Social justice has many dimensions, and we have heard from the speakers who have spoken this morning. And I think the anti-racism advisory group within the IASW, their stance is that social justice cannot be achieved without racial justice. If we think about it, we need epistemic justice. Others spoke earlier about hearing all voices. Ubuntu, which is the philosophy of including everybody. So I think that it is important to say that it's easy to talk about culture and cultural competence, but it's very difficult to talk about race and racism. Race and racism are difficult issues to talk about, but every day people experience them. We have legislation coming up. The minister announced the other day that there's legislation coming into stream, but as social workers, we don't need legislation to address issues of marginalization, of discrimination. We know about anti-oppression and all that. The strategy has got 3 strands. So we are working on 3 strands. One of the strands is CPD and practice. So we have social workers who are looking at CPD and practice, how to, again, embedding racism within that. We have social workers who are looking at advocacy and policy. We have social workers looking at education and research. And as Hilda said earlier, the founding of the strategy came about following the death of George Floyd in the US. We saw the guy being charged the other day. Again, I think for me, it's all very hard because it's an experience that when I watch, it speaks to my own personal experiences. But I think that what's heartwarming for me is that even for somebody like Hilda, who has not experienced racism firsthand, she is teaching us today that there is a space for reflection. There's a space for reflection on how being treated differently is like for our service users, for all the people that we work with. The anti-racism strategy cuts across all areas of social work, be it disability, mental health, or any of the areas of social work, because we are looking to see how does racism impact the service users? How does racism impact people in all those different areas? How does racism impact our profession? There cannot be social justice without racial justice, without epistemic justice, without us reflecting on our unconscious biases. We need to reflect, I suppose, we are called to reflect on our unconscious racial biases, which can impact on cultural competence. So if we are not, if we're not aware of how we can discriminate on other people. And I just want to end on this note because I only have 5 minutes. I could talk all day, but I only have 5 minutes. The note I want to end on is that for me, human rights and social justice cannot just be ideals. As long as we have children in direct provision who are treated differently from all children in the state, children in direct provision do not receive child benefit. whatever the reasons are, as social workers, we need to be looking at, when we talk about social justice, what are we talking about? When we have such a thing that sticks out. So how do we make social justice and human rights a reality in our practice? Not just something that's a buzzword, not just something that's nice to talk about. How does it manifest in our practice as a reality, not as an ideal? Thank you.
Yes, thank you very much, Hilda and Colette. Sorry, I was so interested listening to Hilda and Coletta there that I forgot to have myself unmuted and ready. My apologies. Thank you very much for your presentation. Most interesting. I'm going to move on now to introduce Laura. And in as much as I am, have been really excited, introducing colleagues and who have been around for as long as myself, some of them. It really gives me great pleasure to introduce one of our young social workers today. Because I always say, and any of the students that I visited in colleges, they know what I say, the students and the young social workers, they're the future of our profession. I'm not the future anymore. The social workers, I was once, but I'm not anymore. And the young social workers are our future. So we need to make sure that we listen to them and we include them and we work with them right from day one. They bring a wonderful dimension to our profession. So Laura graduated just back in 2017 and has worked as a medical social worker in an acute hospital setting. And now she's currently in a rehabilitation hospital in Dublin. Laura was chosen to represent the IASW in the International Federation's Europe project called A Social Europe is Possible. This new generation of social workers are the spearhead of change. A subgroup of newly qualified social workers within the IASW are also heavily involved with the next stage of the project, supporting Laura with qualitative research. There's been an amazing response from our young social workers and enthusiasm for this project. So I'm going to hand you over to Laura because it's really, really important now to hear what she has to say about the future.
Thank you very much, Anya, for that lovely introduction, and thank you to the IASW for inviting me to speak today. So I hope everybody is having a lovely Friday afternoon and it's sunny wherever you are in the country. So as Anya said, I am currently representing Ireland as the delegate in the IASW Europe project. So I could talk all afternoon about this project, so I have to keep to time. So this was launched in late 2020 and I was chosen after expressing interest to a call out for a newly qualified social worker to take part in the project. I suppose ultimately the overall aim of this project is to support the IASW Europe member organisations in activating and engaging the new generation of social workers to continue to build on and strengthen our communities and our countries. So as our society changes and develops, there are challenges emerging all the time, and the IASW want to ensure that it and its member organisations activate this new generation in order for us to develop quality social services as an essential foundation for sustainable social and economic development of our communities and our countries. So as our societies change, we need a new or sometimes a reimagined response from our social workers. So this is required in order to set out proper measures and services that are in line with active, inclusive approaches. So the policy objectives, the aim is to develop a guidance ultimately to employers to support our newly qualified social workers when they enter a job and to support them with that transition period from education to employment. The recommendations can and will be modified and adapted for the legislation of each country. So there are 19 delegates representing countries all across Europe. We've met regularly since late 2020, and as in my perspective is only the Irish context, I was surprised with how different countries have with their approaches to their education, to their employment, and the challenges they're facing. So the policy will have to be adapted and reflect the challenges or the things that are working well for the countries. So the project group are conducting a collection and analysis of the good practice examples and good examples from these different countries, and we will base a policy based on these. The project is based on the experiences of newly qualified social workers. You know, I was struck with this project. So often social work is a profession that tries to be defined by other stakeholders, whereas this opportunity is for newly qualified social workers to participate in the creation of a policy document for newly qualified social workers and try and bring about a positive change. So there's a lot of goals, as you can see from the slides. We've some pretty big projects ahead of us to create the policy statement, to organise a flagship seminar, and organise a hearing in the European Parliament. So our timeline, it's a 2-year project. The time is pretty tight. So we all met as delegates in November 2020, and the aim was to create a survey for newly qualified social workers to respond to, for us to begin to kind of get data and the experiences of these social workers in regards to the transition from, well, their experiences from education, employment, what worked, what didn't. So we created a survey and it went live in January 2020, and it was available in a number of languages so that it would encourage and empower as many social workers to take the survey and respond. February was data analysis, so we began to look at the survey responses and pick out the themes that then would form the research questions for the qualitative data collection. So we are now in the process of completing interviews with newly qualified social workers who wanted to further take part following the survey. And there has been a subgroup within the IASW of newly qualified social workers who have joined me, and they're an asset, and I wouldn't be getting anywhere if it wasn't for the support of them. So it's very important that I recognise them and their Trojan work so far. Then we will be analysing the responses from the qualitative data and putting that together to form a policy statement. And then in the autumn, we will be presenting the policies at conferences and trying to get it out there. I also have hoped, and that with our subgroup, is that we will be able to publish an article in the 2021 edition of our Irish Social Worker Journal so that it can get out to members and show what the new generation of social workers in Ireland are thinking and feeling. So in terms of the data collection, it's ongoing, as I said. There have been 782 responses as of Monday of this week. 78 of those are from Ireland. So while I can't provide any pie charts or quotes yet, because the data collection is ongoing, I can give a little bit of a flavour of the responses that we've received from the survey. So the majority of the Irish responders noted that their professional placement that they completed during their studies was very beneficial. However, they would go on to report in the survey that they did not find their education or their employer very helpful with their transition from education to employment. And I was wondering, why was that? What's working well on placement that isn't being translated over? Is it because placements are traditionally very structured? There's goals, if there's very clear roles between everybody involved. And whereas with a job, you might not necessarily receive that same level of support. And as part of our survey, we asked newly qualified social workers, what would they like to see in this policy? And for the Irish respondents, they really wanted to see maybe more mentoring, more monitoring when they get into practice. closer support from their supervisor with a focus on that transition period rather than solely on casework. A lot of people responded of their wish to see protected caseloads, and interestingly, that the policy would make it very, very clear on how employers can assess what's a protected caseload for that particular agency. And then, you know, so that we could achieve effective caseload protection across services in Europe, depending on the agency. Burnout and self-care was also a big one that we saw with the survey responses from Irish responders. And they would like to see the policy name and recognise this for employers so that they could recognise and try and support the newly qualified social worker in developing good self-care techniques to prevent burnout. I think no more than anything, we have to consider the impact of COVID-19 as well, and that will have to be reflected in the policy. To think about how many current and previous students have had the last 2 years of their studies impacted by COVID, and how that transition into employment must be impacted, particularly with this new challenge of maybe working from home in some agencies, that people may not have that peer supervision or informal support that they get from colleagues so readily available versus that when you're in an office setting and that office culture. So from all those, we pulled out a lot of themes, which we have to now develop which we then have developed our research questions on. And the themes, as I've mentioned, they relate to training and education. So the experience of job searching and COVID-19, employment, caseloads, reflective spaces, being able to be empowered to ask questions. The different supports in employment in terms of what worked for you, what didn't. The practice placement or their internship, federation support, trade unions, peers and colleagues, international and national guidance, and the impact of these guidance documents on a person's education and employment. Focusing on kind of what is different in the different countries, in the specific countries. Whereas here, as we all know, we're mandated by cores, so they have a huge influence and guiding light for us in our placement and in our education. And of course, what does the young social worker want to see in the policy statements, or newly qualified social worker policies? And something that we decided as a subgroup in Ireland when we're talking to these newly qualified social workers was, what does the social worker want to see from the profession? And what are their hopes for the futures of social work in Ireland? Where do they want to see the profession going? You know, we thought all those things would be really, really valuable, particularly seeing as we're trying to engage and develop this new generation to be involved and to be the developers of a social work landscape in Ireland that they want to see. So it's going really well so far. All of our interviews, well, we've started our interview process now, and the Irish subgroup, as I said, are instrumental in that. Obviously, they are all being held over Zoom, and we're hoping to really ramp up the interviews. Of course, there's a lot of admin behind the scenes, a lot of support from the IASW and Sarah with regards to setting up and training us up in Zoom and getting consent and all of those. So really important pieces. So that is it in a nutshell, because I'm afraid if I continue, I'll be here all afternoon and I'll have to be booted off. But just to say, if you are a newly qualified social worker in the audience, so that would be someone, say, in the first 3 years of their practice, but certainly no more than 5, and you would like to participate, email us. We'd love to hear from you if you'd like to take part in the survey and have an interview with us. Please reach out. You know, it's not too late. And again, if you're a newly qualified social worker or know someone who is working maybe in your agency, please let them know that they can be involved, and I'd love to hear from them. And again, I just really want to thank the IASW for all their support with this project, the IFSW for all the support and the guidelines and the opportunity to be involved, and my IASW subgroup Thank you.
Okay, thank you very much, Laura. I suppose I'm a bit like a clucking hen at times, but I'm so proud of our young social workers. We have, I work with quite a lot of them in Tusla, and they amaze me every day. And also we have a board member who is, I think, Bridine is about a year or so, about a year and a half qualified. And she's come on to our board, which is a daunting place to go at that stage of your career. And then Laura and this wonderful work that she's doing. So it makes me really believe the future is bright for our profession when I meet such amazing people taking up the professional social work. Now, Sinead McGarry is our next speaker, and I'm sitting here going, "Oh, where's Sinead's biography? Did I not get Sinead's biography?" So, Sinead, I'm going to make it up as I go along here. Sinead is a busy mother, an exceptionally busy mother, who's taken a break from her job. But I think she has taken on the IASW and helping us out with various things as a full-time job, because she is a member that I would have huge contact with over the past about year and a half. She's a very active member of the association and contributes a huge amount in the areas that she is really, really expert in. And she's going to talk to you about some of that today and some of the work that she's done around the residents' rights and particularly things that have come up in relation to COVID and how that has really put a lens on the rights of people who reside in some of our more institutional settings. So I'm going to hand you over to Sinead and look forward to hearing what she has to say.
Thanks a million, Anya, and thanks for, I suppose, giving me the opportunity to talk today about a project that is very kind of, I suppose, dear to the hearts of many social workers because of the connection that we have with the nursing home sector. It originated, I suppose, after a call in March 2020 from the association, and that was a general call put out by the office looking for volunteers, looking for ideas, looking for resources to support the work of social work during the pandemic. Because if we think back, and it seems a long time ago now, but there was so much uncertainty and so much apprehension at the start of the pandemic in terms of what would our roles look like, how services were changing, and how would we deliver. And we wanted to kind of pause and take stock and be able to ensure that our visibility as a profession and our contribution as a profession to the wider health and social care services remained as optimum as they could. So there was a huge response from across the core membership and the core team. And I have to say from the outset, a huge thank you to Danielle, to Marina at the time, to Sarah, who's joined the office since, to Cliona and to Anya in particular, for just backing so much of the work that we have done and have brought to the office, kind of asking for their support at very last minute notice. We've had a real cheerleading team in the IASW for everything that we've progressed. A smaller subgroup started to look specifically, I suppose, about the role and contribution of social work in relation to nursing homes. And from the very outset, we were interested in the lived experiences of the social policies that were introduced along with the pandemic. I should say from the outset, I suppose, in that first slide, I showed you the range of people that came forward. We were very clear at the outset that we were representing the core values of our profession. It was a real return to the core values. And that wasn't, I suppose, necessarily easy all of the time because we're so siloed in the way that we work, particularly in adult social work. People coming from mental health and medical social work and safeguarding, we all view our work through a very particular lens. So there was challenges, but also huge kind of freedom in stepping out of, the politics, the turf wars, all of the things that happen sometimes within our individual agencies, and the limitations that sometimes that can bring to our lens, to work collaboratively to place citizens at the heart of our decision making, to place the people that we work with at the heart of our decision making. We were very clear early on that this was going to be a partnership piece. We were reflecting and amplifying the lived experiences of those social policies that our members were sharing with us based on the work that we do. So it was informed by this distinct advocacy voice of social work. And, you know, any of us that have been in practice for any length of time face the eternal question, what do social workers do? And I think the speakers earlier this morning have really spoken to the need for us to reintegrate the micro and the macro piece. And I like this quote. It comes from our statement, our advocacy statement that was launched later in the year, but it really sums up the experience that we had within this subgroup. So we don't sit on the sidelines just observing. We're not bystanders. We're not simply observing the lived experience of the people we work with. We're active on their behalf. We take a stand for and with those. So we're not working for people solely. We're working in partnership with people who are marginalised, disadvantaged and not heard. And certainly our residents in our nursing homes and our residential sector have been unheard for much of the last year. We speak up for social justice, and we seek the change needed to tackle the inequality and the resources to make that happen. And I should say from the outset, this project was designed to align with public health advice. And so the solutions that we were offering very much align with public health measures that have been successfully introduced elsewhere. From the outset, we had clear red flags, and I suppose the pre-existing concerns that exist within the sector are well known. We have a system that doesn't have a national safeguarding legislation. We don't have safeguarding authority. Social workers don't have legal right of entry to nursing homes. And at the outset, we had HIQA, our national regulator, very clearly highlighting for many years prior to the pandemic, key inherent weaknesses within the safeguarding regulatory system. And I should just, one quote that I think sums that up from the Chief Inspector of HIQA. She was talking about the lack and the length of time it takes to address a failing nursing home. And she said, people should not be subjected to significantly deteriorating care and service quality to the point their very lives are at risk because of the legal limitations faced by HIQA. So that was the system that people were essentially cocooned into. And I would have said from the outset, and the people that we were working on this project, is it cocooning or is it marooning? Because when we solely pursued a policy of prolonged cocooning, we were deliberately ignoring international solutions which valued the role of family within the lives of nursing home residents. And we could clearly see that in the Netherlands, in Germany, in Northern Ireland in recent months. There's been the introduction of care partners where family members have been in for several hours a day, providing support and care to the people that they love in nursing homes. In Ireland, as I said, we had this kind of blanket visiting ban, which is illegal in other countries. We had introduced discretionary visiting guidance, which is paternalistic in nature because it's based on subjective compassion. There is no enforcement of it, so it's very much down to the individual service provider as to how they interpret the visiting guidance and what kind of support they offer. There was no communication care or crisis support in many nursing homes when outbreaks happened, and that was understandable in wave one in the early months when nursing homes were completely overwhelmed and their usual coping strategies simply failed. We saw the same kind of failures in the most recent wave in January, where we had families still standing outside windows looking in at their dying relatives without any communication or contact. There's some harrowing stories from some nursing homes and from some recent HIQA reports indicating the family members were wondering if their loved one had in fact passed away while they were looking through a window and knocking on the door of the nursing home to see if that could happen or if that had actually happened. You know, within that system, and I'm robbing this from a colleague who described family life being viewed as a luxury add-on now. We have got to the point where we've allowed in the recent wave, despite very clear international evidence and international levels saying that there is ways to manage safe visiting without a corresponding increase in infection. We've had window visits continue to be banned. So relatives can't even look through a window at the people that they love over recent months. And that then adds into this whole sense of how can we guarantee people's safeties, or how do we value the role the families play in the protection of people when care goes wrong? We haven't monitored, unlike TUSLA, who have produced the child protection safeguarding stats, or the domestic violence services around domestic violence. We haven't monitored, we don't know what's been happening within nursing homes in terms of safeguarding issues, and we haven't targeted training to specifically identify the increased risk of institutional abuse during lockdowns. And essentially, I suppose, there's been an invisible experience of residents and families and an absence of social work influence at strategic level. Our voice hadn't been heard in the early stages of the pandemic. So what did social work do? Well, we responded as best we could. And this group took a very clear decision that we were going to promote a rights-based approach, recognising the central role, the connection, the protection that family life offers, and arguing that there were clear messages from other jurisdictions that Ireland was in a position to follow and should follow, and morally and ethically should do so. So we provided solutions. We created the liaison social work role in nursing homes and residential settings. I'm giving a very quick overview here. There's plenty of information available on the website in relation to all of these kind of pieces. But that model provided communication care and crisis support during outbreaks. It essentially meant that a social worker moved in. It was represented the work that some liaison social workers have been doing within a small number of HSC nursing homes. And it was identified by the Economist Intelligence Unit as an example of a really innovative practice, and is actually the only Irish project that's going to be included within their annual global report, which will be released later this year. We also provided information on rights to family groups. So Care Champions is a family-led organisation that we've had an alliance with, and we provided visiting refusal information to them because families haven't been given and residents haven't been given any information on what to do if they ask for nursing home visitation and it isn't provided. We also, I suppose, for the first time in this particular issue, we used political channels probably in a slightly more savvy way in terms of taking an approach across opposition and government parties. We've met with opposition politicians. We've met with Minister Mary Butler, the Minister for Older Persons. We've fully briefed government on the concerns and the solutions. And I think that's really important. Social work has identified key solutions that are operational, that are evidence-based, evidence-informed, and in use elsewhere. And we've brought that to government. So no one can say that they're not aware of what's happening within the nursing home sector or how to handle it or how to address it. We have put in a submission to the Oireachtas Committee on Health, which has been repeatedly referenced, and it was valued by the committee. They've repeatedly referenced it in a number of their sittings as a really helpful piece of information, and it's led to their questioning of the HSE and of HICWA, and we're due to appear. We've been invited to appear in front of the committee in the near future. We made submissions to a variety of organisations, the expert panel on nursing homes, the HSE psychosocial response to COVID-19 committee. We've participated in the development of the HSE guidance on visiting in nursing homes. We pushed as much of a rights-based agenda as we have, and it is heartening, although it's not where we want it to be, to see some of our reflections evident and have shifted, I suppose, the policy towards a more rights-based approach, and that gives families ammunition, if you like, in terms of dealing with the visiting refusal when it arises. And I suppose we've also developed media links and new media relationships. We've been fairly active in terms of print media, in terms of writing blogs, and we've completed a webinar as an association in conjunction with the School of Social Work and UCD in relation to visitation rights, the second one done in the world, I'm proud to say. And we've been present in kind of the media in terms of radio and TV as well. And Amanda Casey is very quickly, from the matter, becoming our tele social worker. I suppose I just wanted to give a few quick reflections on this, and really I'm raising I've kind of given a very quick overview of what we have done and what we've tried to achieve. But I just wanted to pause to reflect on some of the things in relation to this advocacy piece of work. The association was ahead of the curve. Research messages are now repeating the concerns that we had and the solutions that we've been developing, which is really heartening and affirming, because sometimes social workers, doubt ourselves as a profession. And as another speaker said, sometimes we look to other stakeholders to define what it is that we do. We have a very clear expertise and a social justice voice here, which is wonderful to use. Okay, so working out of silos, once we step outside of our roles, is a really powerful piece in terms of doing that. We need to be at the table, and we work best when we're aligning with the values of our profession, placing the people we work with and what matters most to them at the heart of policy. This work is an antidote to burnout. What I would simply say, and I'd leave people with a challenge in terms of the ways that we can advocate. So tweeting and retweeting is a way of just spreading the social work message and being part of the online community. We've had fantastic examples. Vivian Guerin has written some amazing opinion pieces this year. Amanda Casey has done a great blog. We've had social workers participating in podcasts, and our colleague Eva Rourke from St. James's was speaking up at a conference yesterday about housing injustice. And it's really important, I suppose, that we start to recognise that link between the micro and the macro. I would say the time barriers, I'm going to be controversial here at the end. If we don't have time to do this, this is the language of bystanders. And doing the same thing over and over again and not achieving change is less effective than taking time out to actually change the injustice that we witness in our daily work. And I'd leave people with a challenge as, for your individual teams. I'd ask everybody to identify one pattern of social injustice in their work, one repeat pattern where they see that people are suffering inequality or harm because of a level of social injustice, and plan a strategic response at team level. Take a small goal, see it through, and watch your advocacy experience and skill set grow. So that's it. I think that's the first time I've finished anything on time this year, by the way.
Thank you very much, Sinead. You know, a mine of information in a really short time, and it's a really good example of how when we get specific and we pick an issue and we go after that issue specifically, how we can. And I can just, you know, I can tell you that you know, this work has gotten attention as high as NEFIT, who I consider to be the controllers of the country at the moment. So I'm going to move on now to introduce Deirdre McCarthy to you. And Deirdre is a policy research and administration coordinator. She did a degree in sociology in Trinity College Dublin and went on to do her master's in women's studies in UCD. She has 25 years experience in community work and a particular interest in community research and policy development. She currently works for the Dublin City Community Co-op, and prior to that she worked for various other community organizations. Her specific areas of concern are to do with social community development, social inclusion, education and training, community childcare, tenant issues and urban regeneration, etc., etc. It's an extremely long list. Don't forget, before I hand over to Deirdre, don't forget to put your start to line up your questions for the panel, because we'd be really interested to hear. And there's really great comments going about all over the place between Twitter and in the chat on the conference platform. But you need to put your questions into the Q&A. Okay. So I look forward now, Deirdre, to listening to your presentation. Thank you.
Thank you very much, Anya. And thank you very much for the invitation to speak here at your conference. I must admit I'm feeling a little bit vulnerable as a non-social worker at a social work conference. So I hope you'll go easy with me. So my experience, as Anya has said, is in community development, and I've worked in community development primarily in the inner city for almost 30 years, although I've also done some work within traveller organisations and have a long history of both personal and professional working with the traveller community. So at the moment I work with Dublin City Community Cooperative, which is a relatively new organisation. We were established in 2014, but we're a cooperative of 13 community development organisations who are based in the inner city of Dublin. And primarily, if you think about that, it's sort of between the canals. We currently have a contract for the Social Inclusion and Community Activation Programme, which you probably heard of as SICAP. And we're the only non-local development company in Ireland that has the programme. And the reason we established a cooperative was to try and maintain that grassroots community development infrastructure that has developed over the last 30, 40, 50 years. So although the co-op is new, some of our members have been in existence for quite a long time. SICTA there on the bottom are based on Mead Street and have certainly been in existence for heading on 50 years. So some of our I would hate people to think that we don't know some of what we're talking about, given that the organisation itself is quite new. So I'm going to do sort of slightly potted or brief history of community development and community work and anti-poverty work. And this is very much from my own perspective, and I'm just going to hit a few notes. I noticed that I've at least one slide that was the same as Anya's earlier. So a lot of these issues overlap, and this is certainly not a definitive list by any means, and is very much from my own point of view. But one of the things that I notice when I pull this stuff together is we're often in the middle of something and it's very difficult to reflect and see change over time. But when you go back and look at it over time, we can certainly see some significant movement. So when I was developing this piece to do, two people really sprang to mind. One was Fergus McCabe and the other was Patricia Kelleher. So Fergus, who worked primarily in the North Inner City and unfortunately died before his time last October, and I was very grateful to have known and worked with, worked for many years in the North Inner City, which is an area that's been characterised by generational neglect and poverty. Fergus's obituary gives a really interesting and quite short summary of 40 years of anti-poverty and community development, if anybody wants to have a look at it. Going back to the Gregory deal in 1982, which is just a teeny bit before my time, to his chairing of the Community Coalition in recent years. But Fergus also, to me, highlights one of the key things about community development. Fergus was a social worker, as probably known to many of you, but he was also essentially a community activist and a community worker. And he highlights that that's what community work is. It's a collection of people coming from a wide range of fields and backgrounds and coming together, doing a particular type of work based on a particular political analysis and approach. And to me, the key point about community development is that activism. So in recent years, we have an increased professionalisation of the community development sector. There's community development courses and training and degrees, which I never did myself. But to me, it's still very important and critical that we maintain that it is a political approach based on a particular kind of analysis. The other piece of work that I think is interesting, if you want a slightly longer read, is a piece done by Patricia Kelleher and Kathleen O'Neill, which was arguing about the systematic destruction of community development, anti-poverty and equality work. And I'm going to touch on some of this later, but really with doing this presentation, we often think of things progressing in a forward movement at all times. And when you look at the history of community development, you clearly see that that is not the case, because the last 10 to 15 years have not been great. So what is community development? I hear you were talking about the definition of social work, and community development is another one where we get everything thrown in, from tidy towns to the Boy Scouts. And while those tidy towns and Boy Scouts are excellent and very valuable and valuable to the communities they work in, they are not community work and anti-poverty work. Critically, community work is a developmental activity that's comprised of both task and process. And the task is social change, to achieve equality, to look for social justice, to aim for human rights. And the process is the application of principles of participation, empowerment, and collective decision-making. So this is one of those cases where, as we think of Machiavelli and the end justifying the means, that is absolutely not the case. And what is poverty? Well, in Ireland, poverty has been defined under the National Anti-Poverty Strategy for many years as poverty are people living if their income and resources, cultural and social and material, are so inadequate as to preclude them from having a standard of living which is acceptable by Irish society in general. As a result of inadequate income and resources, people may be excluded and marginalised from participating in society. And that's critical, that it isn't that simplistic view of not having enough money in the purse to pay the bills. It's much wider than that, and means that people and families experiencing poverty are excluded from many of the things in society in general. I mean, recent research has shown, for example, sporting activities are becoming the very middle class because of the cost involved in families attending them, simple things like football clubs, etc. So critically, poverty is not an accident. As Nelson Mandela said, it's like slavery and apartheid. It's man-made and it can be changed, and we need to be challenging it at all times. So where does the community development come from? So Ireland, I just wanted to show this as it's handed over from generation to generation. So in Ireland, we have a very strong history of social movements, groups coming together to fight for political change in relation to a wide range of issues. I think we often think of the sovereignty question or the Irish question or whatever way it wants to be determined. But we have a long history going back to the 1850s around land reform. And actually, if you look back to the demands of the Land League, they're remarkably simple then, are remarkably similar to what we're looking for today around security of tenure and fair rent. We have history of working class activism. And why is it so strong in Ireland? Well, I think of two key features. One is probably our history of colonialism, where we had very little legitimate access to power to change things. So there were social movements from the ground up that tried to fight for change. but it's also as a result of the failure of the new state to take on the main social issues of its time in the 1920s. Instead, issues around health, social care were left to charities, and we know the consequences of that. So that principle of subsidiarity meant that the state did not take that kind of responsibility. So we've a long history of social movements going back München in the 1930s, the women's liberation movement. That was the picture that Anya had shared earlier. I think that's from the contraceptive train. We've the student movement, anti-nuclear movement, National Farmers Association, the Save Wood Quay, which, as we know, didn't save Wood Quay. But anyway, it was one of the main movements. And then Concerned Parents Against Drugs, working class activism that also exists. That is my dishwasher just stopped. Working class activism in inner city communities. And this was all taking place around the time of things like civil rights movements internationally, and in particular civil rights movement in Northern Ireland as well. But in Ireland, historically, and unfortunately to this day for some people, poverty was often viewed as an individual pathology. The poor were a problem, but they were a problem of their own making. And the approach in dealing with people in poverty and communities in poverty was a charity-based model, where the poor were given resources that were deemed by others they were fit to receive. And they had very little power in challenging the systems that were actually maintaining their situation of poverty over time. And as we know, charity is very individual, it's very erratic. It often just deals with the effects of poverty, not the causes. And critically, there's an inherent power imbalance between the giver and the receiver. The receiver doesn't get to determine what they need. And I think this is often exemplified by the perennial discussions about why do the working class spend so much money on communion dresses or flat screen TVs? And if they didn't spend their money that way, they wouldn't be poor, which of course is rubbish. But in the 1960s and 70s, in Ireland, we start to see a movement towards the examination of poverty as a structural issue. This picture here is from Sheriff Street in, I think it's the early 1980s. And Sheriff Street, which I'm going to show some examples later on, is an example of a community that has experienced poverty for generations. So internationally, we had the civil rights movements and political movements, but in Ireland, in developing in the 80s and 90s, we also get a growing political support for community development and anti-poverty work. In particular, senior politicians, including the likes of Mary Robinson, but also senior civil servants like Dermot McCarthy, who had a powerful position in the Department of the Taoiseach, started to understand and agree with the importance of empowering local communities to create real social change. So we were starting to move away from the previous approach, which was either charity-based or maybe purely left-wing politics, to developing a community development model. Interestingly as well, of course, between the 60s and the 80s, Ireland had massive examples of extreme and absolute poverty. So again, that's Sheriff Street. And here we have an example of travellers on that halting site in Ireland who up well into the 90s were often living in conditions that didn't include running water. So poverty, while it might seem really obvious, and I'll get back to this point later, was very clear and visible and evident and in front of us. In the 1980s, we also witnessed the development of this vibrant community development sector. So the state was starting to fund the sector. And essentially what was happening was those citizens and individuals who were involved in those movements of the 60s and 70s started to become employed in community-based organizations that the state were funding. So the 1980s were hard times, but we did understand that poverty existed. It wasn't denied. I was going to use two examples. One example of land as an issue of structural poverty, access to land, and whether you have land or not. So in Ireland in the 1980s, the country appeared to be run by and for landowners. We discovered years later, what many actually did know at the time, that there were massive levels of corruption at local and national level, in particularly in issues in relation to land and land use. And this fundamentally affected communities like travellers and the urban poor. In the northeast inner city, there were social movements, particularly around these issues of poverty, but also poor social housing. We had another traveller families on the site, like children literally playing in broken cars. We had movements towards homes at the moment to improve social housing in particular. And it's just amazing. This is from the 1980s, and we're in exactly the same position now in the, what are we in the 2020s, where if you do not have access to good quality homes and housing, poverty really can't be changed or moved. So these were movements that were supported by local people in the communities who were actually experiencing the problems. The other main movement at the time around tenants issues was also, of course, the Concerned Parents Against Drugs campaign and other movements in relation to drug use. So as mentioned by Anya earlier, the late 1970s, early 1980s really witnessed this huge heroin epidemic in inner city communities, and that particularly affected the communities of the North and South inner city. There were a number of wins. The Gregory deal itself put inner city poverty on the map, although the Gregory deal didn't last very long because that government essentially collapsed after a few months. It was one of the first times that political powers that be recognised, well, whether they recognised it or not, they were forced into a position of trying to address poverty in a particular community. Another win, which we don't really hear about anymore, is there had been plans to develop a motorway through the centre of the northeast inner city of Dublin. And that was stopped, which if anyone who's been to Belfast can see the damage that can be caused by a giant motorway running through the centre of a city. I believe and would argue that the northeast inner city still has one of the strongest community development infrastructures nationally because of the likes of Tony Gregory, who has also since passed, Fergus McCabe, Mick Rafferty, who I used to work with. So you might ask, where are the women? Well, this is one woman who I think is very powerful. This is Nan Joyce. Ireland in the 1980s, and I think it was referenced by one of the earlier speakers, was often thought of as a monocultural society, but it wasn't. And you can ask any traveller who's around would tell you that. But migration till then was largely outbound rather than inward. But there were movements, community development and anti-poverty and social movements among the traveller community, and one of which was led by Nan Joyce. So Nan was one of the founders of the Committee of the Rights for Travellers and became the first member of the traveller community to stand for election in the history of Ireland. She went on to form with other travellers a traveller-based organisation called Minker Mishling, which evolved from the Traveller Rights Committee. Nan sadly died a number of years ago as well, but in 2010, she received a Lifetime Achievement Award from the then President, Mary McAleese. But this is what we were also facing. Lack of solidarity, working class communities against traveller communities. And what really is going on there is a tension for land, because it was disadvantaged communities throughout the city who had no access to land. And racism, let's face it, that was also happening. So during the 1990s, I'm going to call it the heyday of community development and anti-poverty work. We have the state recognises community work. The principles of community work are acknowledged in a government white paper on the relationship between the community and the voluntary sector. We see state funding at an organised level. We have the establishment of the Community Development Programme in 1990. In 1994, the establishment of the Family Resource Centre Programme. And we see widespread models of community development service provision being developed throughout whole areas in training, education, in programmes around violence against women. In 1994, we see the establishment of the Equality Tribunal, and we know in the 90s there was the development of equality legislation, which was really very powerful and had moved Ireland really quite significant steps from the 1980s and previously. We have to recognise that the expansion of community development and anti-poverty and equality measures in Ireland did take place within the context of the national partnership and social structures we had going on at the time. So if anyone remembers, we had these big national partnership negotiations going on. And in 1994, the Rainbow Coalition brought in civil society groups, as they called them. So there was a community pillar as part of the national partnerships. I would also argue that in the 1990s, we saw the rise of the equality agenda after the losses of equality issues in the 80s, and I'm thinking of like the 8th and divorce. So the 90s saw the rise of equality as an issue that we were being looked at, it was being addressed. And Europe had moved us to a large extent. So poverty, though, was still very evident. In the early 1990s, and again, it was mentioned earlier, I was working in the South inner city at the time. And apart from drug use, HIV and AIDS was also spreading around the community. One of my first jobs out of college was interviewing women who had essentially nursed their dying children, some of them more than one child. And these women were isolated, traumatized as a consequence of the death of their children, but also because they were completely excluded due to the HIV status of the children and the fact that they were drug users. This was all a consequence of poverty. So during the 1990s, the community sector gained strength. Towards the end of the 1990s, we see, I think, a rocky period ahead. Some mainstream politicians, the big P of representative democracy, started to get quite concerned at the level of power that the participative democracy or the community development sector was perceived to be having. And we get what I would call the fight back. So the boom begins. Early 2000s, this is Bertie and his Bertie Bowl, which obviously never got built, but I think it exemplifies a lot of what was happening again in the 2000s. Again, it's about land and land use and who gets the land and who doesn't get the land. We are moving away through the 2000s from poverty as an issue. Poverty literally falls off the table. The Fianna Fáil government and the PDs that come into power in 2002 and enter a coalition established a new department, which was called the Department of Community, Rural and Gaeltacht Affairs. Also it was called Craggy. And Craggy was a disaster. The sector starts to be taken apart. Essentially, I would argue that Ireland was part of an international movement of the rise of the neoliberal agenda. You could be argued that it was a fight of the right against the civil rights movements internationally that had produced some of what had happened in the 1990s. Patricia Kelleher's piece gives a really good argument about how there was a fundamental shift in the paradigm about how civil servants, public sector, and the politicians were analysing and understanding poverty and community development. A shift from participative democracy to neoliberalism. So I'm running out of time, I think, but essentially what happened in the 2000s was that things were closed down. Community development was closed down, CDPs were closed down. We moved into a new model, a new approach, and the approach was all about value for money, targets, activism, and the social receded into the background. Essentially during the 2000s, there's Johnny Rowan, essentially during the 2000s, it was actually my job to prove that poverty still existed, laughably. Apparently it didn't. So here we have the docks during the 1990s, and here we have them now, aren't they beautiful? But communities from working class inner cities areas were moved out, but they still exist, they still live there. So here we have Sheriff Street, the Sheriff Street area and the Docklands area. I'm just going to do it quite fast because I'm running out of time. And we can see it's actually two communities. The top half here is the poor working class community that's lived there for generations, and the bottom are the ones that live in the IFSC. If you live in the orange areas, you have about a 5% chance of going to third level. And if you live in the blue areas, you have a 90% chance of going to third level. So this is poverty and inequality, which still exists by and large. This is the boundary wall, which is literally this enormous wall that separates the Sheriff Street area from all the nice apartments on the other side. So what's happening today? I would argue that we are paying the price, or we are paying the price of corruption and issues with land going back 30, 40, 50 years. And it's a story that's never discussed. The Moriarty Tribunal and the Mahon Tribunals never really examined the impact on the most disadvantaged communities in Ireland. The way land was sold, travellers were actually paid off to leave certain land so that shopping centres could be built. So I'm going to move just to say for the fights for the future that I would argue, today's battles. One is the rise of fascism and populism, an international issue, but also a critical issue in Ireland. We see a weird conglomeration in Ireland between anti-vaxxers and racists coming together to challenge any initiative that has mentions of poverty or equality within it. We need to challenge the weak and underfunded education system. We need to look at poverty and class, and they must be grounds for equality. And we need to rebuild after COVID, and essentially in planning for the recovery after COVID, because COVID has exposed how deep-seated inequalities are in our society. In planning for our recovery, we must consider the needs of the most vulnerable in society, because if they're cared for and protected in that recovery, everything will be better, and we cannot go back to the normal because the normal wasn't working for many in our society. That was probably a quote that you all saw at the start of the pandemic when we complained about social distancing, et cetera, where it acknowledged that, you know, if you could social distance or work from home, you were not disadvantaged. So I'm going to leave it at that. I'm sorry for racing through at the end, but I was given my time warning. So thank you very much for giving me the opportunity.
Wow, Deirdre, thank you very, very much. That really was super. It has a slightly, you have community work is quite embedded in some ways in social work, certainly the social work that I grew up with. But you've really kind of nuanced, that bigger picture stuff about the Ireland we live in today, and where what the issues are, and wonderful food for thought. Now I'm going to introduce our next speaker, Breed Featherstone. Breed is a professor of social work at the University of Huddersfield in the north of England. She has extensive experience of researching families, the experiences of child protection and family support service, and was a member of the Child Welfare Inequalities Project. This project produced groundbreaking findings on the relationship between poverty and child protection services. She has recently completed a thematic review of the implications of COVID-19 for policy and practice in child protection. So I'll hand you over now to Breed. We're just getting Breed's slides up there. Okay, Breed, good to go.
Thanks very much. Thanks, Anya, for filling the gap there. I'm really bad at sharing my slides, but I've got there finally. I was more nervous about the sharing of the slides than speaking, I have to be honest with you. I'm delighted to be here today. I was so honoured when Clona asked me to speak at this conference, and have been looking forward to it for ages. I mean, the only sad thing is that wouldn't it be lovely if we were all together? I haven't been to Ireland now for 14 months, and I'm missing it terribly. And I was really smiling to myself as I was listening to Hilda, particularly. Hilda, sometime we must have a chat about being a culshie. I was a culshie in Trinity College, Dublin in 1974, which was a very interesting experience. Today, I'm going to talk about, it follows on really beautifully. I don't know if you organised it like this, but it follows on extremely well from Deirdre's last couple of slides about the challenges that COVID has exposed and the possibilities and the problems going forward. So what I'll be talking about is, what has the pandemic taught us about society, about families and social work? And crucially, going forward in social work, what do we want to restore? What do we want to repair? And what do we want to change? So it's not quite learning from history, actually, because I'm going to start with the novelist, Albert Camus. I mean, like, I'm sure a lot of you have been reading around this terribly odd time we've been in, have been thinking about it and looking at the historical evidence. And of course, lots of people have been reading The Plague by Albert Camus, and he talked about the pestilence as it one plague and as it one blight and plague. And as at once blight, but also revelation. It opens up, it exposes the hidden truth of a corrupt world to the surface. Well, I mean, that's a very dramatic term, but in fact, the history tells us that actually pandemics and disasters more generally, such as, for example, earthquakes or whatever, they bring both loss and gain. I am mindful of Carolyn's injunctions about multiple histories and contested histories, and it is very clear reading back that there are such complex things that goes on when you go through something like we're going through at the minute. The Spanish flu is a really interesting example, almost forgotten really. And when you think about it, it killed, estimates vary, but it killed between 50 and 100 million people. COVID, tragically, current estimates has killed 3 million. So the scale of the Spanish flu, is clear from that. It influenced the course of World War I. It pushed India closer to independence, but South Africa closer to apartheid. Frank Snowden has done a great book called The Epidemics and Society, and he talks about how epidemics themselves can both help us, as the Spanish flu did, to bring in universal healthcare, because there were so few people left in so many parts of the world that actually it was decided we better take care of who we've got left. But they can also entrench racial and economic discrimination. Historically, Jewish people were driven out of towns and cities in the medieval times as a result of plagues. We have had in our own times HIV used as a source of stigmatization of gay people and of people who used drugs. So both loss and gain are features of this. What has COVID itself brought to the surface? Well, in terms of gain, there is quite a bit of evidence. I mean, it is a life course thing, COVID. We went into a lockdown this time last year, and there was a particular set of issues that seemed to emerge, particularly initially around kindness, around solidarity. But as I'll talk about later, that seems to over time have eroded a bit, certainly in England, from where I'm speaking. We've seen amazing, amazing evidence of our scientific expertise. That to have got vaccines up and running in such a short period of time is just extraordinary and unprecedented. We've seen not always publicly recognised in the way we would like, and certainly in England we haven't had a Prime Minister speak about the importance of social work or health and social care in the way that has happened with Leo Varadkar in Ireland, but we have had a recognition more generally of the importance of care and care as both formal and professional. Now, it may seem really odd to say this, but we've actually seen how important good government is. And the reason that we've noted that in England is that we have been subject for quite a while to quite poor government in all sorts of ways. And we've seen that it's both important at a local and national level for governments to be competent, to be humane, and to take action around a whole range of things too. And in our case, it was extremely important that they mopped up and they supported a social protection system that was really creaking. So £20 was added onto universal credit immediately. There was a stop on evictions. There was a whole pile of things that happened. Now, as I'll go on to say later, they should have been necessary. If we'd had decent systems in the first place, they wouldn't have been necessary. But it was, it's proved important, as we've seen now in the US with Joe Biden's work, that it's kind of given a lie to all those neoliberals and those market fundamentalists who've been saying you don't need government, let the market decide. Actually, a very powerful message has been sent across the bow of those kinds of market fundamentalists, as we realise that we really do need each other, and that paying taxes into a collective pot and having a competent administration is extremely important. We've seen the importance of social protections, as I'll go on to show in a minute. Unregulated, insecure labour markets leave people without literally anything to fall back on when something like a pandemic strikes. It does seem across the world that more equal societies seem to have done better, and many of those societies appear to have had women leaders, and the two things may be linked. I'm not trying to be essentialist about it. We have some very, very unhelpful women leaders over time and in history, but in societies where there has been a deal of equality and a commitment to social protection and to supporting each other, and you've had women leaders, you have had more competent and humane policies. And just to reel out some really quite painful names, if we look at what's happening in India, if we look at what's happening in Brazil, if we look at what happened in the US under Trump, and if we look at the death rate, sadly, in the UK, one thing stands out, which is around the quality of the male leadership and their commitment to a particular kind of politics, which has been shown to be very destructive. So a lot of good things have come out of it, but there's a lot of evidence to support a more gloomy assessment. And this is important in terms of what we will need to rebuild and rethink going forward. The countries, as I said, the ones that have been more equal and have a better legacy seem to have done better. But the countries that had already sewn in a whole range of issues, say in relation to the devaluing of care, the deep history of gender inequality, the quote at the beginning is from the wonderful Indian academic, she's not an academic, she's an activist, Arundhati Roy, who also is a novelist. She has been writing, and she must be weeping today about what's happening in India at the minute, but she's been writing about the wreckage of a kind of neoliberal train that has been careering down the track for years, with its emphasis on individual self-advancement, its emphasis on the market being the solution to everything. So she's at one end, a very clear critic of the models that we've been developing over the years. But perhaps surprisingly, people like Mark Carney, who was the last director of the Bank of England, has written a very interesting book, actually, about values. And he draws quite a big canvas to say that the three crises of this century, the credit crunch, which had a disastrous impact in Ireland, COVID, and the climate crisis, which is unraveling at the pace of knots. He argues that all three of them pose vital questions about the balance between the market and society, and how we've allowed the market to become the arbiter of what is valuable and what is valued. And he, this is a rather big slide, I apologize, but I just wanted to put it down. This is a quote from him. He talks about three paradoxes, which I will just leave with you. But one is, for example, why is water, which is essential for life, virtually free, but diamonds, which really have very limited utility beyond their beauty, are so expensive? Water isn't always free, actually, but in some countries it is actually privatized in really unhelpful ways. Why do financial markets rate Amazon as one of the world's most valuable companies? But actually the value of the region of the Amazon is absolutely being, it appears not on any ledger, and it's being deforested in the most frightening way. And finally, as we saw in COVID, how can we reconcile our celebrations of the extraordinary values of public service, dedication, and the heroism of health and social care workers and social workers with their often low wages and perilous conditions? And tragically, I teach on a health and social care course at Huddersfield, and many of our students are working in the care economy. And sadly, we lost one to COVID during this period, which brought home very vividly some of the messages I'll be talking about in a minute. Rebecca Solnit is a climate change activist and a feminist in the States, and she writes a lot about disasters. She's made a study of disasters and their impact, and she looked particularly at things like the San Francisco earthquake. And one of the things she argues is the first lesson a disaster teaches us is that everything is connected. And at moments of immense change, as we're seeing at the minute, we see with new clarity the systems, the political, economic, social, and ecological systems in which we are immersed as they change around us. We see what's strong, what's weak, what's corrupt, what matters and what doesn't. And I'm now going to move on to give some examples of those connections and how they've come together in disastrous ways, particularly in relation to who's died in this lockdown. So in the UK, of course, people were killed by a virus, and that virus had the potential to impact us all. But in reality, it is not an equal opportunity virus. Mortality from COVID-19 followed the social gradient. The social gradient is a term that's used to describe the phenomena where basically people who are poorer have worse health and die more. And it's been applied by Sir Michael Marmot, and particularly in the UK, but across the world really, by public health people to understand ill health, to understand life expectancy rates, and to understand mortality rates. And what we've seen, and I was at a presentation in my own local authority where the university is based yesterday, and it was graphically illustrated. The people in the main who died were the people who were poorest. The people who got illest were the people who were poorest. So yes, Prince Charles got it. Yes, Boris Johnson got it, but the people who died were the poorest. as Rebecca Solnit has argued, everything is connected, and what we saw in the death rates in relation to who died and where they died, there were particular issues around for Black and South Asian populations particularly. And this is a stark example of the differences. So over 58,000 and 35,000 additional deaths would have occurred if the white population had experienced the same risk of death as the Black and South Asian populations. And if you remember, at this point, we are on about 150,000 deaths in the UK. So add those numbers on, and we are talking something really horrific. What were the connections? The connections were that Black and minority ethnic communities were more likely to live in poor housing, were more likely to work in occupations where they were, as was quoted, overexposed and underprotected, were less likely, so for example, taxi driving, where we have a very low rate of statutory sick pay. It's a policy choice we've made or our governments have made, that we expect people to look after themselves if they get sick. We've one of the lowest in the rates in the OECD countries. So people faced extraordinary ethical demands. As a parent, for example, do I go to work and feed my children, or do I stay at home to avoid infection and run the risk of my children not being fed? So do I risk infection and feed them, or do I not? Lots of people were living in overcrowded housing. Massive issue around housing. I really heard what Deirdre was saying, and I've been following some of the work that Rory Hearn has been doing in Ireland around housing. As we'll see in a minute, housing has slipped off the social work agenda big time in England. We're trying to put it back on because it's a massive issue and is a social crisis that has been 30 years in the making. People died at differential rates. But as we locked down last March, we also realised vividly that we were living in very different circumstances. Lockdown took on hugely different significance for people who had gardens, who had access to digital technology so they could move seamlessly into home working. But we also had families who were living in bed and breakfast, who were trying to keep the children safe from infection. We had families who were living on the top of high-rise flats, who had to go down the lifts to grab a little bit of green. The weather was beautiful during the first lockdown. People were in flats on the top of buildings where they couldn't open windows with little kids. So as Damien Barr's tweet, which has echoed all over the place and people use it all the time, we might have been in the same storm, but we were not all in the same boat, and we certainly weren't all in the same house. Some of us have seen our savings rise. We have been able to have quite nice lifestyles, if a bit lonely. Other people have been really struggling with the consequences of a social settlement that has expected people to look after themselves, to be able to feed and clothe themselves, and to not expect too much from any governments. What have we learned about social work in this period? Well, I didn't know that when I was doing this that Rory Terrell was going to be speaking today, but actually this is a quote from an article he wrote in The Guardian, and he argued that internationally social workers had gone back to basics and developed a bottom-up supportive ethos. That there had been, he argued, across the world, a rapid return to what he called traditional social work principles, which was regular contact with clients, even if at a remote level, accessibility through technology, an emphasis on early initiatives to prevent problems escalating, and a focus on community action. And certainly it was really interesting. We did, and there's some very good studies come out now that are more rigorous, but right from the start, we did quite a lot of anecdotal kind of like going through Twitter, doing online consultations with workers. And it was really extraordinary. And some of you may be aware of the fact that a group of us got together in England and we established a magazine for the lockdown, the first lockdown. It was a mix of across the UK. It was primarily academics, but we really, really encouraged reflections, a page, a poem, a little short story, an analysis, and we had 5 volumes. We're just doing something else at the minute, which I'll tell you about later. But we had 5 volumes of this journal, and we got from team leaders, from social workers working with young people, from parents who were locked down, whose children were in care or had been adopted, from young people themselves. We got a massive range of reflections. But one of the things that really stands out for me was and this is the gain bit. How many social workers told me that kind of they would normally go around to, say, a foster placement to visit a child and to see if they were okay for their regular review, and how often the child would really, or young person more accurately, would really not engage, and they would be left talking to the foster parent or to the carer, grandparent or whoever. And social workers come to me saying, do you know, I did a Zoom call and the young person joined it, or I'm having lots of WhatsApp conversations with them. So in terms of gain, people were telling me that they were really enjoying the possibilities that were being opened up. Local authorities played a huge role alongside the third sector and mutual aid groups in providing help with food and other essentials. And whilst it wasn't always clear that social workers were involved in it, sometimes they were, certainly in some local authorities, they were absolutely much more on the case about this than they had been. And the reason I'm sounding surprised is that people mentioned that, you know, as part of the Child Welfare and Equalities Project, when we did our research back in 2016 with social workers, we did a large quantitative study, which I will tell you a bit about, but some of you will have heard about it. But when we did the qualitative work with social workers, I remember so vividly one quote that we used a lot, where a social worker said to us, well, you know, we do refer people to food banks. We do that, but it's not core business. Our core business is the assessment of risk and the assessment of parenting capacity. This was back in 2016. And suddenly during lockdown, we were hearing from social workers who were saying how important it was not only to provide valuable help, but how much they were enjoying the fact that that families were happy to hear from them, and families were acknowledging how helpful it was to have people take an interest, and it was breaking down some barriers. It did make social workers also reflect on some things that perhaps we had taken for granted. For example, we are very reliant upon the home visit. That's the source of, that's the main activity in child protection, particularly, that we use. We've lost our commitment to community work, and we don't even do much group work often. So the home visit, the individualised home visit, has been really, if you like, the linchpin of practice. And it really did make some social workers think about the problems with that. And there's some nice articles about this in the COVID magazine. And people were saying, do you know, we have really got very little knowledge or intelligence or understanding of the communities in which our families live. And this is now, the chickens are coming home to roost, if you like, because, you know, if we can't go in there to see the family, how do we know what's going on? We had a situation as well where a lot of other professionals had withdrawn. Health workers, health visitors had got drawn into the big national NHS effort. And in the first lockdown particularly, teachers, schools were open for vulnerable children, but it was quite limited. So there was a huge well, not a huge, I'm exaggerating, but there was a thinking about, like, we've been very reliant on a particular way of engaging with families, and we've paid very little attention to the communities in which people are linked into. We have very little idea about whether they're strong communities. We've very little idea about how isolated that mother is or isn't going to be, because we simply haven't been asking people those questions. We have been going in with a very household focused, very narrow, parenting capacity focused, risk focused, and it's been very much centred on what happens within the house. And we have very little knowledge of what kind of street the mother lives on. Is it a good place for a Black woman to be living on? Is it a place that a lone father gets support in, and we have very little knowledge of communities, both their strengths and their weaknesses. But we did do, because we were so worried about keeping in contact, we became incredibly aware of digital inequalities. And I noted John's comments on that earlier. It's a massive issue, a really massive issue. We have had women have their children removed during lockdown who were on the end of a phone with very poor reception. We've found huge issues about how digital inequalities have played out in the most consequential ways for people. Having said that, local authorities rushed to provide phones, to top up credit, to ensure that they were able to keep in touch with people as much as they could. They cleaned phones, they bought phones, and they bought digital technology where they could. It's posing massive issues for them now as they face into the future because they're so short of money. Again, this is of interest given our previous research, which suggested that social workers and child protection workers weren't that interested in the practical difficulties that parents might experience with attending meetings. So, for example, help with transport costs hadn't always been offered. I often tell this story and apologise if you've heard this before. The bus fare story became a metaphor for us in the Child Welfare and Equalities Project, based on a true story of a father who went to a meeting and before the meeting said to various professionals, "I've spent my money on getting here, I'll need my bus fare afterwards." And then the meeting happened. The recommendation was that adoption should be pursued, which of course is incredibly upsetting, and he was in tears at the end of the meeting, and he went around each professional in turn trying to get his bus fare, and he was directed to an office to fill in a form. And so we saw in lockdown a kind of rethinking of that and a rethinking of the lack of practicality of that. We also saw, which I think is really, it wasn't a massive theme, but it was a really interesting theme, that we saw some schools and social workers reflecting on the possibility that our involvement with families can itself be a source of strain. That if families have to keep going for multiple appointments, if they have to keep going to different offices, if they have to attend a range of meetings, without transport, but also without any lunch being offered or whatever, that can be very stressful and stressful and anxiety provoking. And that actually some social workers said to me, our families are doing really well. They're actually calming down. School is a huge source of anxiety for some children, and they're actually relaxing. Now, of course, that's not a long-term sustainable solution to trying to make schools more child-friendly and trying to make schools less anxiety-provoking and less exam and attainment-oriented, particularly for very vulnerable children. But it is, again, a source of reflection about our contribution as agencies to families' difficulties. So, going forward, we've seen throughout the pandemic that we had a certain kind of social settlement, certainly in the UK, where we had a very insecure labour force. 7% of our workforce were on kind of 0-hour contracts, got work one week, didn't another. We had a very high proportion of people living in private rented housing, which is a key driver of child poverty, can be very poor quality, lots of issues for children in terms of their well-being, if they're living in damp accommodation and repairs aren't done. We had a social settlement where if there wasn't good commitment to sick pay, so people had very little to fall back on when the pandemic happened. And so our government had to rush into action. So, for example, you will have heard possibly about the school meals issue. So it took a footballer, the amazing Marcus Rashford, to argue for the need for children to continue to have school meals, because it was actually the only meal they were getting, even if they weren't at school, to continue to provide school meals. And that was a huge wake-up call, that we had so many children who were likely to go hungry if they didn't get a good meal at school. So going forward, Arundhati Roy has talked about the pandemic as a portal, a gateway between one world and the other, and the next rather. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and our dead ideas, our dead rivers and smoky skies behind us. Or we can walk through it lightly with little luggage, ready to imagine another world and ready to fight for it. I think in social work, we actually have quite a lot of luggage now that will help us to move forward, possibly. It's not bad baggage. I think we have some good baggage that can help us to move forward. And I've been hearing so much today that has given me such heart about how we can move forward together. If I'd been physically present, I would have stood up and cheered at loads of points, especially this afternoon, listening to people like Sinead and others talking about the kind of ideas that have been being developed. On a societal level, people like Michael Marmot, the public health expert that I mentioned before, has talked about the need to build back fairer. That's not just because it's a moral issue, but it is, but it's also because it's a preventive issue, because if and when the next pandemic comes, we can minimize the amount of tragic deaths. If we have a more equal society, if we have fewer people living in poverty, if we have fewer people living in poor housing, if we have fewer people being subject to racism and afraid or unwilling, or because of our immigration system not able to access healthcare when they need to. If we build back fairer, if we attend to the causes of the causes, we have been dealing constantly, and this is something I want to talk about in relation to social work, we've been dealing constantly with symptoms. Deirdre has talked about this as well. We've been dealing with the symptoms of poverty. We talk about obesity in terms of behaviour, and of course it is a behaviour and it has to be tackled at a range of levels. Caroline is quite right about, you know, I can never pronounce his name, but the ecological perspective of dealing with the different levels. But to deal with obesity as if it's simply a matter of willpower and a matter of choice, and to offer, as I've heard people attached to the current government here, suggest that we give people Fitbits. When we know that access to good quality food is extremely variable, that good quality food can be very expensive, that people in poverty spend more and more of their money on those kind of basics than people who have more income, and that it isn't always easy, certainly in some of our estates, to access decent food, cheap, good quality food, and that bus fares are very, very expensive. A lot of our buses are privatized. So to get to the supermarket without a car with 2 or 3 young kids can be a real challenge to pick up good food. And you may be reliant on local shops that are very helpful. We need to attend to the causes of the causes. The story each time is remarkably familiar. You know, if we don't tackle poverty, we are not tackling mental health. If we don't tackle poverty, we're not tackling domestic abuse. If we don't tackle poverty, we're not tackling substance misuse, all those wicked issues that end up being manifest as symptoms in our child protection and in our social work system. It doesn't mean that it's just about poverty. It doesn't mean that it's all about poverty, but it is really the golden thread through so many of our difficulties. More broadly, people are arguing that we need to develop a new social settlement, that we need to think again about the idea of us, that we're just simply individuals that look after ourselves and look after our own family's well-being, that we have to think again. We found in the lockdown how dependent we were upon each other, how interconnected we are, something that originated and there's controversy over exactly where in China it originated, but something that originated in China had the ability to lay low so many people right around the world. How we live together, how we travel together, how we feed each other, how we engage on all sorts of levels really, really matters. And we found that we are all at the end of the day vulnerable. This notion of independence is a fantasy, that we are all vulnerable. We're not all equally vulnerable, but we are all vulnerable, and we rely upon the kindness of strangers. We rely upon the kindness of strangers for ourselves, but also for our loved ones. And when we couldn't go in to see them, and when we worried about them, we had to hope that they were being looked after properly. And people have talked about how, as I said, we pool our resources, we pay our taxes, and then we can help each other when times get tough, as they do. And we can work together to meet the challenges. Okay. So that all sounds really Pollyanna-ish in a way. I don't feel Pollyanna-ish about it, though. I do think the analysis that's emerged is actually very powerful, you know, and it's being manifest in some of the work that Joe Biden is doing, but it's also right across the world, people saying some of the are saying some of the right things. However, there are going to be big obstacles. There will continue to be big obstacles. This is a quote from a public health professor in the US who talks about the importance of radically fostering compassion and actively fostering compassion going forward, and that is going to take work. We cannot assume that we will be able to continue to feel a sense of solidarity, feel a sense of connection with each other. And one of the very things that will stop it is that actually, do you know what? For a lot of us, this pandemic has been heartbreaking in many ways, but we haven't been affected in the same way as so many others. And so initially our empathy was linked to the fact that we all felt at risk. It was informed by an appreciation of our own personal risk. But now, as we realise how differentially it's affecting people, so as the inequalities and the intersectionality of the inequalities has become manifest, there is a possibility that we start to distance and we start to think it really isn't about us altogether, it's about them. It's also the fact that we have been able to develop a vaccine, and I know there are problems with vaccine rollout in Ireland, it's one of the few things that we've seemed to be doing better at here, but the fact that we have been able to develop a vaccine, it does mean that a lot of people are going to be protected. Of course, they're going to be the most powerful and the most advantaged people in society generally that will be protected, and that will also erode that sense of solidarity, and will also promote the idea of us going back to normal, because of going back to the old normal, which, as Deirdre said, of course didn't work for so many people. And I just want to give you quite a shocking statistic now, that this is a study that was done quite recently in the UK, which kind of absolutely is a warning to us not to assume that it will all be okay, that we will all move together and we will all move forward together in solidarity. Frank Snowden, in his book on epidemics and society, has talked a lot about how they can entrench stigmatization and othering. And I mentioned that before, didn't I, in terms of how AIDS, HIV did, but also historically the did, fostered discrimination against Jewish people. This is a study that was done recently, this early part of this year, and in the UK, nearly half of the people surveyed believed that those who lost their job during the pandemic were likely to have been underperforming. It was their fault, in other words. It shows you how powerful those ideas about if you're poor or ill or struggling, that idea that it is something about a defect in your character or a defect in your lack of ability, your inability to take up the opportunities that this society offers you, and the complete absence of a structural analysis of the reality of where jobs are situated, how easy it is or isn't to access them. And of course, we did have a lockdown. So loads of people lost jobs in the hospitality industry, in the retail industry, and many of those incidentally were women, which has real implications for child poverty going forward, actually, because of the link between lone mothers and child poverty. So nearly half of those who were surveyed believed those who lost their job during the pandemic were likely to have been underperforming. In one of the starkest findings, we found that 1 in 8 Britons said that they thought Black people were more likely to be unemployed and have lower incomes because they lack motivation or willpower. And as people have been saying right through, particularly in the first incredibly powerful presentation from Hilda and her colleague this afternoon rather, and I really apologise, I can't remember the name. This is me getting so old. I really apologise, but that presentation moved me to tears because I know that we've been living through the Black Lives Matter. We've been waiting with bated breath for the verdict on the George Floyd case. We have had massive conversations about racism. We've had Black young people being stopped during lockdown, being criminalised for restrictions of lockdown, for breaking lockdown much more than their white peers, with all the implications of that in terms of like developing criminal records, etc. We've had really big public conversations about racism and structural racism and institutionalized racism. And yet 1 in 8 Britons think that Black people are more likely to be unemployed and have less money because they don't work hard enough. They're lazy. We found, or it wasn't a study I did, the study found, and there's a link to it on the slides, the study found that whilst there was a sense that people thought, oh, Yorkshire has been left behind or Wales has been left behind and we need to level up, they didn't think that there was any need to develop differential strategies for either races or genders, even though the evidence is quite clear that they've been disproportionately affected, but also tragically for young people. And we know that the future for many young people, particularly those who are deprived and particularly those who are Black, is looking very bleak indeed. And we also know, don't we, that if you don't get that first job, you're not likely to get the next one. And so if young people are starting off their lives unemployed, you know, we're going to have to do a lot of work to rectify that and to make better lives available to them. So this issue of kind of stigmatization and othering linked to power in our society, power relations in our society, and who makes the decisions and who makes the rules, lends a certain level of kind of necessary pessimism to any assumptions that we're going to come out of this nicer and better people who will work together in a better way. So to social work. What do we want to retain from what we have learned during the pandemic? What do we want to repair? And what do we want to change? These are very live questions across the globe, and they have been particularly live in the UK as people have been trying to think about, well, do they retain remote working, for example? Do they retain remote child protection conferences? Do they retain a remote family justice system? And one of the things that's emerging from that particular set of questions is that there seem to be 2 worlds emerging. Do you remember I said that it was a bit of a life course, that we start off, we're all in this together and we look after each other, but that over time things have started to erode and people have started to differentiate and to distance themselves a bit. Not completely, it's far more messy than that. There's a lot more good, kind, empathic people out there than the opposite most of the time, thankfully. But one of the things I was a bit shocked about recently was I was reading some research on remote case conferences and remote care proceedings, and there was 2 worlds were emerging. So the professionals, and these weren't just social workers, there were all sorts of professionals involved in child protection and in family justice, were saying, particularly in the child protection conferences, they were saying that they quite liked them, that it increased the involvement of GPs because they were able to just log in, and it made for better multi-agency representation. And equally, family justice, a lot of professionals were saying, oh no, they work quite well. But what was apparent and emerging quite strongly from the families who were interviewed was many of them really, really were struggling. Whilst it is very hard to walk into a child protection conference as a parent to find it full of professionals, it is really intimidating, and we know that. And that's partly, not only, but that's partly why family group conferencing has developed and is more valued, it would appear. But whilst I said it was hard to do that, it is really hard to be sitting at the end of a phone trying to understand what on earth the chairperson is saying to you when your kids are clamoring for the phone because they've got to do their homework on it and it's the only bit of kind of internet you've got in the house. Again, digital inequalities and really come into play there. And so what has become apparent is there may be 2 worlds of emerging based on people's different access to technology, different living conditions, and different experiences of lockdown. So what do we want to retain? What do we want to repair? And what do we want to change? And I'm going to I have no idea of the time at all. So these presentations where you're talking into the void, and I'm terrified to keep my phone on because I'm terrified it'll start ringing and somebody talking to me in the middle of this. So I'm hoping I'm okay and I'm on track, but I'm sure I'll be told shortly. Okay, so some thoughts from child protection. I mean, in a very immediate sense, Carolyn is absolutely correct. Child protection brings up so many absolutely sharp tensions around care and control, and it's so subject to binary thinking. Child protection social workers are the best people in the world. They rescue children from terrible, painful, traumatic lives. Or child protection social workers are the worst people in the world. They're literally child snatchers, and they ruin people's lives. And I've been doing an awful lot of thinking about this. I'm not saying I avoid binary thinking at all. I know I don't. And I find myself struggling with conflicting emotions. And that's partly because, and this is one of the cautiously optimistic stories I want to tell you, because for the last 4 or 5 years in England, we have really, really been on a bit of a journey in relation to getting more storytellers into our arenas around child protection. So, and I mean, this is only one example. It's not the most revolutionary example, but for example, when Anna Gupta and I did the adoption inquiry back in 2016 to 2018, we brought together in the same room, and I don't think it had been done before, but we brought together in the same room for a day birth parents who had lost their children to adoption, adopted adults, adoptive parents, social workers, and lawyers, and some academics. So small groups of people, and they worked together for a day, and they told their stories to each other, they heard each other, and they talked about how things could be made better. And I cannot emphasize enough the importance of opening up spaces for us to try and move away from the binary thinking. But also, as we have found in the work we have done on the Child Welfare Inequalities Project, we also do need to name some of the harm we have been doing in this work. So in terms of changing the stories, we need to change the story that says that an individual child rescue model will contribute to social justice more generally. Because when we look at the consequences of our individual actions, what we find is, from the Child Welfare Inequalities Project, from the evidence, we find that a child in the poorest part of England is over 10 times more likely to come into care than a child in the richest part of England. That's the result of individual actions that were done with the best of intentions by the best of intentioned social workers. But the cumulative consequences are that we are reproducing some systematic inequalities in children's abilities to be able to live safely within their families and within their communities. And when we then put that evidence together with the evidence from people like Karen Broadhurst and our colleagues in Lancaster, who have looked at the parents who have multiple children removed, more than 2 children, I think was their criteria, and many have much. Okay, that's great. More than 2 children removed. Many have many more than that. What we find is so many of them those parents were in care themselves. So our individual actions of child rescue have systematic consequences, but they also don't interrupt the cycles. They don't interrupt the intergenerational transmission of inequality. So I'm feeling cautiously optimistic because we're having some good conversations in the midst of a lot of pain and chaos and worry about money. I think we want to retain the supportive ethos. Social workers prefer to working in a kinder and more humane way with families than they have been doing. I know that's a difference between England and Ireland. The supportive ethos has been kept much stronger in Ireland, but in England, the child protection bit has been characterised by, I'm here to assess your parenting capacity. I'm here to assess the risks you pose. And even when there was a strengths-based approach, it was often very subject and very subordinated to the risk model. I think there's a lot of repairing of the harm and pain that's been suffered during the pandemic, the pain of the mother who's had a child removed at the end of a phone, but also the pain. If you remember what I said about deprivation, we work with the most deprived families. They're the families who've had the most loss. They're the kids whose grandparents have died too early, whose parents may have died too early. So there's a lot of pain and hurt there's also a lot of pain and hurt within our wider workforce, particularly the social care workforce, where people, particularly Black and minority communities, have been disproportionately impacted by the pandemic. And of course, there's been the stress and anxiety of working from home and not knowing what's going on for families. So there's a lot of things that we need to retain, to repair, but we also need to change the stories we've been telling about ourselves and to own up to the complex, messy world we're in, where we do have to balance care and control, but if we don't act to challenge the injustices of poverty, to challenge the fact that families don't have a level playing field in terms of caring safely for their children. They are not all equal. Just as they're not all equal in terms of the virus, they're not all equally given the chances to look after their children safely, then we won't be keeping to the beliefs we have around social justice that are so core to our identity as a profession. So very finally, I think we need to broaden our conversations. Hold my hands up here. We've talked too much to ourselves as social workers. We really need to talk to public health people. They are fantastic. But crucially, we need to talk to families. Kate Morris and I did a piece of work a few years ago with families who had experienced more than 9 services. It was deliberately looking at multi-agency involvement with families. And I'll tell you, they knew what good systems were like. They knew what works. They knew how to design a system that they could feel engaged with, and nobody had asked them. Nobody had ever said to them, "Do you know, what do you think might be good? Where should we put the office? Is it good to have a neighbourhood office?" We need to be both more ambitious in terms of of what kind of society we want, but we need also to be more humble. We can only be a part of this. We need to make sure we get things right, as Sinead was saying, the things we can do, the practical things we can do, like to make things right in our own backyards. But we won't achieve social justice on our own. That's part of a much bigger conversation. Okay, thank you.
Thank you very much, Breed. That was an excellent presentation and very really thought-provoking. And it's I think what we know in social work is, you know, history, it never ends. We go forward. We'll never, you know, we keep trying to get it better, and that's where we keep going. We keep trying to do better. I've got some questions, and those of you who are with us in the audience, don't forget to put your questions into the Q&A, and I'll be able to deal with them there, and not the chat, the Q&A, okay? So I have a question for Laura, our youngest panelist, to put you very quickly on the spot. Laura, this is a question from Kate Gillen, who she's a social worker and an IASW member, and she works in the Department of Children, Equality, Disability, Integration and Youth. I'm glad she wrote it down, because I can't remember what they call themselves at the moment, but because they've added various bits into our Department of Children. But Kate is asking you, Laura, if of the Irish respondents, do you have a breakdown of where they were employed? And she was saying there are similar initiatives to survey new entrants, and it will be very interesting to compare responses if possible.
So I actually do have a breakdown for the Irish respondents as part of the survey. It's great what you can do with Excel and surveys now, where you can break things down very easily. So I suppose, whereby I can't share exact numbers yet, the majority of respondents would have marked that they're working, say, child protection, child welfare, working with children and families. But we do have, there is quite a lot of medical social workers who've responded, then some people working in mental health, some people working with homelessness. So, and then a couple of them, one person, one or two people then in other agencies. But there is a lot of choice on the survey, particularly that had to be represented because it was being circulated all over Europe. So the way people might consider their agency working with children and families in one country, we might consider that child protection here. So it was very important that we gave it, if you have the opportunity to look at the survey, There's a lot of choice, and it was a multiple choice question as well, so that you could push, say, working with children and families, working with homelessness, you know, so you felt that your agency would be represented. I didn't realize that TUSA was doing a similar survey. It's definitely something I'll make a little note of here in my notebook, and certainly see, can we work with each other's data, or particularly maybe see if there's any learning between the two. And it would certainly be great to, if we had the opportunity, to reference that potentially in our article or our submission to the IFSW with our policy, with our findings from our Irish research, and also present potentially to the IASW, because it would be nice to feed back to this organisation about what this cohort of new social workers are feeling. So I'll make a note of that. That's great. Yeah.
Absolutely, Laura. Thank you for that, because I think and the office, we can put you in touch with Kate in the department, and you can have a chat with her, and I think that would be very, very useful to see if what themes are coming, and where the commonalities are with your work and with what TUSLA have done and what TUSLA do. Excellent. We can certainly put you, that's you see the big advantage of being in the IASW. It's a fantastic opportunity to link up with people and join together. The next question I have here is in relation to, I'm not sure who made it, who put it in, but what they're saying is just wondering what kind of things that social workers are doing now in practice and in education that we could or should continue to do when we come through the pandemic. And she says, or he says, this question comes from the idea of building back fairer. So what are the thoughts of today's speakers? Who would like to, I mean, a couple of people can respond to that because it's a really, really important one. Who would like to respond to that initially? Breed, would you like to maybe kick that off, and then we can I'm sure other people have thoughts on it.
I think I mean, I gather I just read something the other day, but I didn't have time to fully read it. We've all misinterpreted Maslow's hierarchy of needs, but I don't know. I think that, to be honest, this is speaking from a particular perspective. I'm always aware that I'm speaking from the English context. I think we have to keep that sense of it's not the end of the story, but it has to be the beginning of the story, which is we actually deal with people's practical needs first. You know, it doesn't mean we solve everything, but we do. You know, a mother cannot concentrate on being a better mother if she's worried about paying the bills, if she's worried about debt. And so one of the things we've been doing, I mean myself and Kate Morris, is we do a lot of work with local authorities now on poverty aware practice. So we get people to really think about poverty proofing their work, and that includes a debt making sure that they have access to debt advice, but also to income maximization, to making sure they're getting what they need. Sorry, not what they need, but what they're entitled to. So that kind of practicalities, and there's a number of anti-poverty frameworks around now that I think are really useful. So that would be just one thing I think that would be really helpful.
I can add to that, Anya, if you want.
Yes, Caroline. Yes, please.
So I think just following on, and thank you, Breed, for that excellent presentation. I think the awareness, the increased awareness around poverty, the impact of the digital divide, and just the empathy in relation to the experiences of some individuals, young people and families in light of the impact of COVID-19. I think that really hopefully will stay with us in education and practice in terms of reigniting that responsibility to be aware of those social inequalities. I think there is a real opportunity for a recognition of the importance, just as Breda said there, about material and practical help, and how social work needs to see that as part and parcel of the work, as well as therapeutic and policy-based, and across the different levels, back to the systems level I was talking about earlier. But just from an education point of view, something really excellent that has happened certainly from my perspective, and I'm very grateful to all of my colleagues around the country for this, both in practice and education, is that the crisis of COVID-19 as it presented to us and the need for responses has led to a lot more cooperation between our education programs and between education and practice. And in terms of us all, I think really needing to work together and using the opportunity of the online forums to be able to share platforms. So this year, more than ever, our students have benefited from engaging with students across the country, and we've had really great opportunities for engaging practitioners. And just finally, I think for some practitioners, while it's always lovely to be in a room, and I did send a message. I'd love to have been there at lunchtime to have actually seen everybody whose name I'm seeing, or to meet people who I haven't met. But having said that, for busy practitioners, I've noticed that a capacity to attend and share and be involved in these learning has hugely increased, because it's for an hour or two, not traveling to the west or traveling up to Dublin. So I think they're just elements I think that are really important for us to keep going forward.
Anya, maybe I'll pop in with this as well. Just to reiterate what Caroline is saying about the educators taking advantage of Zooming so that we can work more collaboratively together. And I suppose one of the really good things that has happened is that part of that educators working together piece has been that they have taken on really reviewing anti-racism as part. They have an actual group that are looking at that issue, so that's really supportive, and Colette and myself are going to work with them hopefully to move that forward. So that's because that is, as you may have remembered, that's one of the streams for the IASW anti-racist strategy plan. So that's been moving forward. But just on topics that other people raised, I suppose for me, Breed's comments about being more positive, being more poverty focused in our work, I think that's hugely important. But I would also couple that with what Deirdre was saying. One of my big bones of contention, if you like, about social work and how it's kind of developed at the moment has been stepping back from our initial roots in community. Yeah. And I just think that is to the detriment of everything we do if we don't really get back to handle that issue. And I loved Breed's description of how people felt very confident that they had made assessments of families and had no idea of the communities those families were living in. I mean, to me, that's just such a terrible indictment against social work. We started with community and we really need to get back to it. So, I mean, that's been a mission of mine. Anyone who knows me and my work in terms of social work education, that's been something I've been plugging away at for a long time. And it would be really good for people. I think social work students in particular sometimes find it very strange if we in the academic world are promoting some particular thing like community work. And group work is my other issue as well. And then they go out into the field of practice and lo and behold, there's nothing to do with community and they get very few chances to do group work. So there has to be a match between what we're preparing people for and then what happens when they're out in the community. So that there's a collaboration needs to be done around that as well, I think.
Yeah. I'm just going now to a couple of questions there, and I just want to refer just Sinead, Laura, Anna Denneher has put up a comment just saying this is more of a comment, and Anna Denneher, as we know, is a principal social worker in Tusla, and she says she's also involved in the Tusla initiative, and as our representative on the project, it's being carried out under the International Affairs Committee, of which she is the chair, and she is very happy to provide you with feedback on both projects. So that's super. Thanks, Anna, for that. There's one question I'm going to hold for the end. There's a question for Sinead there. Do you consider new insights for social work were gained through your recent partnership and advocacy work with older people, families and carers?
Absolutely. I think there's just been huge learning across the board, and it's really, I suppose, developing what Hilda and Breed and Caroline have just said. That whole piece around even working as a community of social workers rather than in our individual agencies and in an individualistic way. And I completely echo that call for us to value this social justice mandate. And I think there's an opportunity here. Certainly one of the big learnings and insights for me was that, we often compartmentalize practice and theory so much. And, we start this in the universities and then we do it in practice. We're all guilty of it. But I suppose it offered new opportunities just to use data cleverly and smartly with the assistance of academics who I think are leaning more towards a social justice lens in many ways, just as practitioners are leaning more towards seeking data to validate their experiences. And I think it isn't just ourselves. If you look at what psychology and occupational therapy and speech and language therapy have done recently, appearing in front of the COVID committee, giving a very clear perspective of the social injustice experienced by children with disabilities. It's a really powerful model of how using simple data in a clever way can capture your message and your expertise. And whoever, I think it was, I can't even remember who said it earlier in relation to, oh, it was Laura, I think, that we often look to other stakeholders to define what we do, but we often try to emulate them. I know in my own practice, trying to almost be a feeling, you know, I have to really clarify what I'm doing in my clinical counselling skills, really working with clinicians, feeling I have to articulate social work in a language they understand. And for me, the biggest insight is we need to speak our language. And as Breed said, not just to each other, we need to speak it clearly with other stakeholders. But most importantly, we have to hear what the people we work with think, want, and what is working for them. So it's on lots of levels, but we need to move from that individual model. That's all of my insights. I never have just one, unfortunately.
Thanks, Sinead. Sarah Daly from TUSLA, another TUSLA social worker, her question is, she is for Coletta. She says, I'm so interested in this idea of our unconscious social bias. And what she's asking, Coletta, is she's asking you particularly, do you think this is a question we should openly ask our clients and colleagues about when beginning working with them? Her connection dropped during your presentation, Coletta. She apologizes. So she's saying apologies if you actually address this in your presentation, but she lost you in the middle of it. So perhaps maybe, Coletta, you could speak to that.
Yes, I'm interested in the question at two levels. That the person who asked the question asked, is this something we should address in our own practice and with service users? Why that interests me is because with my research, which was supervised by Caroline McGregor, I looked at social workers and families. And what I found was that both families who were in the asylum process, who were going through a difficult time, had assumptions and stereotypes about social workers. And equally, social workers had stereotypes and assumptions about those families. And on both levels and at both points, there were unconscious biases that both families and social workers were carrying. And that those unconscious biases needed to be teased out and needed to be pieced out. So I just think in terms of reflective practice and in terms of reflexivity, in the spirit of reflection, in our own work, I think that for me, social justice is reflection, is around, we can't do social justice practice without reflective practice. And I do think unconscious biases, we all have them. I have them. I have them, everybody has them. But unless we work to address them through reflection, we can do damage to the social justice that we want to the principles of social justice that we want to uphold. So I think in terms of, is this something we should address with ourselves and with clients? Definitely. I mean, there were families in my research who had, because they had experienced white supremacy in their countries of origin, dealing with a white social worker, it just brought up issues for them, full stop. They had assumptions about what that would be like and the intervention would be like before so just putting the question on the table, just putting these things and I think social workers, we are good at doing that. We can do that. Name the thing and put the unconscious biases there, have a platform to address them, to help to move on. Yeah, I hope that answers the question.
Can I just chip in on you with that and say,
of course,
that the thing about unconscious bias for me is that we have to look to ourselves first. That's be part of our practice first. And it is actually, you know, following on what Coletta said, like in social work, whether we like it or not, we're very often, we do have power. We're in a more powerful position than the people that we work with. And it's a very skilled thing to try and help somebody to think about their unconscious bias when they're in a powerless situation and when you haven't done it yourself. I think it's a bit arrogant to think of doing it if you haven't done it yourself first, and really to recognize how challenging that is and the context in which we're doing it.
Thank you for that, Hilda, because I think, yes, of course, and today is part of, you know, reflecting, and you know, that's what conferences give us the opportunity to do, to reflect on what we do and what we've done and what we would like to do in the future. And if you're not, if you can only, I always think you can't change, if you think about relationships, you can't change someone else's behavior, you can only change your own. And it's the same with unconscious bias. You've got to become aware of your own biases and prejudices and all of those things and start to address them. And you're absolutely right. That's the first, you've got to start there. And this is a big question in some ways, I think, and I don't know who sent it in, but it's an interesting question. And the question is, and in the spirit of looking forward, that's why I kept it till now. What do panel members want for the social work profession, and to hopefully achieve in the next 5 years? So I suppose we have people here from different elements. We have people from education, and we have practitioners. We have Deirdre from looking in, and people like myself and John, who are at the end of really our active working in social work, and so. I wonder who would like to maybe address that. What would you like to see happening for social work in the next 5 years? Can I kick it off by saying one of the things I think we need to do is, and Deirdre's presentation really resonated with me, largely because I recognized all the pictures, because I was there in the 80s. I recognized all the issues. I was the Laura of the 80s. I was there. I was out there learning. I hadn't grown up with any kind of hardship. You know, I grew up in middle class Dublin, and where probably your greatest dread was that, Jeannie Mac, you might get the call to be a nun, and what would you do then? And because we actually believed that. So you know, I went into this life where I was visiting families down in the Midlands who had no electricity and no running water and no toilet inside their house. And I was not sure, I'm not shockable really, but I suppose that was the start of me learning that I could absorb lots of other people's lived experience of their lives and not be shocked by it, that the world was a much broader place, a much bigger place than I had actually thought it was. And, you know, social work, you know, where I think we've got to get back to some of our roots, community work being one. So some of the other comments that we made, I think we've got, you know, relationship, this online world, you know, relationship goes in this online world, because we can't have that. We only have formal interaction. We don't have any informal interaction. And it doesn't matter whether you're doing a foster care review or a child in care review, or whether you're having a meeting like this, it's all very formal. So I think we need to get back as quickly as we can to that, you know, one-to-one direct interactions with people. And the downside of that will be that we might not get through the same volume, because we're getting through fantastic volume of stuff at the moment because we're not driving between places. But that will be something I would see in the next 5 years, that we will come to a place where we will take the best of what COVID has forced us to do and integrate it into a better future, but looking back more to community and relationship, and, you know, working not just for people, but not for people, but working with those people who use the services that we work in.
Sorry. I was just going to, I don't know, somebody else was going to chip in there, and then I came in. Who was that?
You.
Okay, go ahead.
Okay. No, I was just going to say, I mean, for me, well, I've already made my play for community work and I return to that. So that's obviously on my cards. But just following up on what Sinead said, I just really feel that what I would like to see the social workers into the future being is more confident about themselves and about what they're saying. And to be confident, they have to have the data to back them. That's the world we live in. We just have to have information to back us. So that's what I would really like to see, because I think we have information on what's going on the ground. That information often isn't digestible to people who are making policy decisions. They have a certain diet of how they get information, and whether we like it or not, we have to be able to speak in a language that they can get, and they do get data, and they do get. I think Sinead said something about simple data or something. Sometimes the data they get is so simple it's meaningless, and yet they follow it because it's data. So I think we need to use data. I think social workers need to be really confident about that. And I suppose the second thing I think is that one of my friends in the States always says to me, if she wants to see the complexity in something, she always talks to me about it, because I seem to see the complexity in things. And I do think social workers see the complexity in things and see that nothing is always straightforward, but we don't have the confidence in a world where it wants us to make decisions and be absolute. We don't seem to have the confidence to always stand up to the fact, look, it's not that simple. There are different angles to this, and we have to appreciate all the different angles. So that would be my wish, that social workers become more confident and that they know how to use the data to get their message across, and that the message they're getting across is a message that we're working with the clients and with the service users to get across what they need to have heard.
I would, oh, sorry, John, go ahead.
No, you go ahead, Sinead. I'll come in after you.
Are you sure? I was just going to
Yeah.
I suppose it's, I think that we need to be careful as a profession. There's real advantages to associated with specialization, but I think we're at risk of losing the relationship-based nature of our work. Before I finished up there for maternity leave, I sat in a room with a safeguarding social worker, a primary care social worker, a mental health social worker, and a medical social worker. We have to stop talking about people as cases, and we have to stop developing our services to suit our needs as professionals and go back to what matters most to people. And most people don't want 4 social workers involved in their lives. And I really think we're at risk of losing our way. And I actually think at the moment, some of the conversations that we're not having are around the turf wars that are happening within social work. I think that suits the political kind of agenda very well, in terms of that the infighting is all happening at this level and we're not resolving those issues. I think we have to have really honest discussions, both as social workers, and I've learned so much from Caroline this year in terms of listening with a social work ear and a citizen's ear, and going back to asking people what matters most to them and then planning our service accordingly. Really feel if we keep going the way we're going, we'll lose our way and we'll lose that relationship-based practice. It's a challenge for all of us, and it can't just be on days like this that we discuss it. This needs to be in our teams and in our daily practice.
Okay. Oh, John,
sorry, can I just come in briefly, because a lot of what I was thinking has already been said, so I absolutely agree with the previous speakers, but I do think that when myself and Cliona, and I think Hilda, and maybe yourself, Anya, we were talking about this conference several months ago when we started to plan it, we said we wanted social justice to have social justice in there to start the conversation 50 years down the road, to see where we've come from, but also where we're going to. So my hope in the next 5 years, is that this will stay on the agenda. It won't be just for today. And I think I would love to see the profession continue to grow. Well, when I say the profession, but the association to continue to grow, because I think our strength is in our numbers, and it allows us to do things. Because a lot of what we talked about today, it's more difficult to do as an individual in an individual practice setting, but together, and people have mentioned this already, as a collective, as a group, we can use the association to, and I think Sinead's work, your work, Sinead, has been an excellent example of how we can use the umbrella of the association to push for change at a policy level. And I think the other piece for today as well is around the whole issue of poverty, and we need to get back to looking at that, because it underlies, I think as Breed says, it's the thread that runs through everything, and echoes where we came from in our community development and community work history. So I'll shut up now.
And Anya, maybe I could just add one short line.
Yes.
You know, just
Caroline.
following on the particularly having listened to Hilda and Colette, it'd be fantastic in 5 years' time that we see the strategy in action and that we are more confident and more explicit in terms of our practice, particularly around anti-racist practice and generally. And then just sort of like a point I made earlier of it'd be wonderful for us to continue an approach where there's dialogue and the recognition that we need equal contribution from our practitioners, from the public, from service users, academics, to help us to think this through. We can no longer do this in silos. And I think, again, not just doing it on our own, but listening to the message that we need to be working with our colleagues as well. Thanks, Anya.
Okay, thanks for that. There is another question, and it's around social workers and abuse of power, and it's a huge question. And I think a little bit too big to get in the 30 seconds that I have left here, because I really do need to wrap up and thank people, right? I want to particularly thank CrowdComs, who are in the background here today. They've been absolutely excellent. This is the second experience I've had with Elaine from CrowdComs, and she is, it's a very professional service they provide for us in terms of preparation before the event and in terms of the actual run out of the event. The second person I want to thank, of course, is the committee that pulled today together, which is John and Hilda, and not leaving out Cliona, who today could not happen. No CPD event or no conference could happen without Cliona. She's had to learn very quickly and very fast how to do all of this thing in the digital world, and it's been difficult for everyone. But she has, if you like, shouldered the burden of all of that for IASW, and I thank her sincerely for that. At the occasion of our annual conference, I just want to thank again Danielle McGoldrick and Sarah MacDonald, our two office staff. Without them, IASW cannot function. We hope, we live in hope that we will be able to meet personally. We would love to get some of our older retired members to come with us and raise a glass and say, you know, celebrate the fact that, you know, part of what they were involved in from the start is now 50 years old, and we would love to do that. We do hope that perhaps October, November we might be able to do it. So watch this space. We still live in hope that perhaps the autumn might be a different time for all countries. I just want to sort of finish up by saying I threw out a comment earlier by saying that in the newspapers they referred, in one article I read, social workers being like plainclothes nuns, and I had known many, Sister Joanna, Sister Irene, Sister Peggy. I worked with many a nun back in the day, and they were amazing people, and they were the maybe forerunners, some of them, of some of the services that Deirdre's now working in. But I have an 11-year-old grandson, and I find it very hard to let life go by without a mention of him. And he was asked one day by somebody, my sister said to him, you know, my friend, the nun. And he said, what's a nun? And she said, it's somebody who lives in a convent. And he says, what's a convent? And he's very good with language. But I can tell you, he knows what a social worker is. And I will finish with that.